Well, good afternoon. I'd like to call the PCPID meeting to order. I am Jim Brett, the chair of the President's Committee for People with Intellectual Disabilities, often simply referred to as the PCPID. I'd like to welcome all PCPID committee members joining today's meeting. We have 34 PCPID members in total, representing both citizen members and officials from across different federal agencies. And I'm also so pleased that we have such a strong meeting participation. I'd also like to extend a very warm welcome to the members of the public for listening in today's meeting. I understand we have over 400 individuals from the public registering for this event, and we thank you for spending part of your day with us. Before we proceed with the business of today's meeting, I would like to briefly highlight the historical work of this committee to date and how we got to where we are today. After the full committee convened in July of 2022, there was a consensus reached by the PCPID committee to focus on home and community-based services, often referred as HCBS. 4 work groups were formed to examine issues focused on 1, direct care workforce crisis, 2, employment, 3, community living, and 4, federal support programs. Each work group was charged with help answer the following questions. How can we address the direct support professional labor shortage crisis? How can we further advance competitive integrated employment for people with intellectual disabilities? How can we ensure the right critical support tools are in place to promote independence and community inclusion? And finally, how can we ensure federal support programs are fair and equitable in its service delivery? Well, to help answer these questions, the full committee convened in May 2023 to hear testimony from both members of the public and scholars to help further guide the committee's understanding of the barriers faced by the intellectual disability population. And during the second half of last year, each of the 4 work groups continued to sift through these complex issues further and propose recommendations during work group meetings facilitated by Serena Lowe, who was brought on board last fall as our PCPID report writer. And today, our meeting objective is to hear from each of the 4 work groups of the issues and the recommendations that are ready to be brought forward to the full committee for further reflection and discussion. I would like to sincerely thank the 9 PCPID work group co-chairs, work group members, and report writer Serena Lowe for your leadership and contributions to help move the national needle in a positive direction, focused on strengthen and expand home and community-based services. It is only fitting that we are meeting today. Each year on March 21st, the United Nations observes, quote, World Down Syndrome Day. Down syndrome is the most common cause of intellectual disabilities. This year's theme is In the Stereotypes. And each of you are champions to further advance this month's DD Awareness Month theme a world of opportunities to help lay the groundwork to remove obstacles faced by both intellectual and developmental disabilities population within communities across the United States. Before we proceed with today's meeting, I'd like to introduce the facilitator for today's meeting, Alex Bernardi. Alex is currently Vice President, HSRI, and directs the organization's intellectual and developmental disabilities team. Alex work is driven by a passion for improving supports and service for people with IDD. She has a deep understanding of the use of the national health data to describe the health outcomes for the IDD population. Alex is also a clinical assistant professor at the University of Massachusetts Chan Medical School and teaches in the Shriver Center LEND program to lend her expertise to the medical community. Alex, thank you. Thank you for taking the time to facilitate today's discussion.
Thank you, Jim. This is Alex Bernardi, and I want to thank you all for having me here today. I'm very grateful to be here with you and to facilitate this important discussion. As facilitator, I would like to share a few housekeeping items to help smooth things along for today's meeting. Number one, as a reminder, this meeting is being recorded. During today's meeting, the public will be in listening mode only, and we very much appreciate your interest to join us here today and to observe as a virtual audience member. For committee members, I know you're familiar with this platform and have had experience with this, but a couple reminders. You can participate, your lines are muted to prevent background noise and interference during the meeting. When you have a question or comment, you can do one of the following. You can raise your hand using the icons available at the bottom of your screen, and a member of the census team will unmute your line. I will be keeping an eye on that, and if you don't find the icons and would like to raise your hand generally, I'll try and keep a lookout for that as well. You can also enter your comments into chat, and those will be visible to audience members, and I don't think that they will be visible to the public. I will be reading out all comments that are written into chat as well to make them available for everyone. I have another role here as facilitator, and that is to keep track of the time and as we're moving through this important conversation. Please allow me some grace too. I may need to gently nudge us along as our discussion is going along to make sure that our remarks we have an opportunity for all to reflect and to share their perspective. We use often a way of thinking about this, and we use the phrase, think about stepping up and stepping back for those people who are really, really very, very often talking, using their voice to speak up. We give them an opportunity to think about, you might want to think about stepping back to make sure that people who might be a little quieter have the chance to step up and share. Now I would like to move us along and introduce Allison Barkoff and Jill Jacobs. Allison Barkoff is the acting administrator for the Administration for Community Living. Allison leads the coordination for ACL programs nationwide on issues affecting people with disabilities and older adults. Allison is a sibling of an adult brother with developmental disabilities. Also, I'd like to introduce Jill Jacobs. Jill is the commissioner of the Administration for Disabilities within ACL. Commissioner Jacobs oversees the administration of the DD network programs and independent living. Jill is a lifelong grassroots organizer. Allison?
Great.
If I may, I apologize, but this is Jill. If I may, before you get started, I don't see the sign language interpreter highlighted.
Yeah, Jill, I've been emailing with the team, and I think both CARD and ASL, they are working on that, Alex.
Okay, okay, thank you, appreciate that.
Yeah, and for Alex, maybe you can loop in with our team. I think we're supposed to have CARD and ASL. CARD should be on at the beginning and at the bottom. I think we have that and captions.
Hi, Allison. Yes, this is from Halima from Team Census. Interpretation or the sign language is available. If folks click the interpretation icon at the bottom of their screen, as well as the caption. So both things are available.
Okay, great. So just to emphasize for accessibility for everyone, CART and ASL, you should see a globe, it looks like, kind of on the bottom of your screen. That will get you to the interpreter, and CART should be under captions, under more. Is that correct?
Excuse me, I only see the sign language but I don't see the interpretation.
Yeah, if someone could put in the chat exactly what to do, where you see the 3 dots that say more, if you click there and go to captions. Sean, you should be able to do it. And if I could just ask for the, first, Alex, could you please put in the chat the specific instructions for people so we make sure this is accessible to everyone?
Will do.
Okay, thank you.
Perfect, thank you.
Thanks. Thanks, Alex, and good afternoon, everyone. As Alex said, I'm Allison Barkoff, and I have the privilege of leading the Administration for Community Living. And I want to thank you, Jim, for your leadership of PCPID, and every single one of the members who have really devoted so much time and so much energy for this really important work. And thank you to Serena Lowe for your support of the team. ACL takes so much pride in the work of PCPID, and really thank you for your hard work over the last several months on this report to the President. We really know how important this report is, both to the President, to the leadership of this administration, but also, most importantly, for people with disabilities across America. And just sharing a little bit of framing, and you all took a very big bite in the topics that you're covering in this report, but we are truly at a crossroads around community living. Now, on the positive side, I think there has never been more visibility and more momentum. Not just one, but in 2 State of the Union addresses from our president. He talked about expanding home and community-based services to help people with disabilities live and fully participate in their communities. And strengthening and expanding access to home and community-based services has really been a priority across all of the federal agencies. And I just want to hit on a few things that we truly have done that is moving the ball forward. Really because of the incredible advocacy from the disability community. As part of the American Rescue Plan, there was the largest investment in home and community-based services in decades. What states have now leveraged to be $37 billion of investments in home and community-based services. For the first time in more than 40 years, we in ACL have been working very closely with our partners at the Office for Civil Rights in updating Section 504 of the Rehabilitation Act, really the pinnacle statute that prevents discrimination against people with disabilities in all federal funding, including provisions related to the right to community living under the Supreme Court's decision in Olmstead. We're on the cusp of really one of the most foundational rules around accessing home and community-based services with the Medicaid access rule and its provisions to increase access and strengthen the direct care workforce. We've been part of cross-agency efforts to implement the first ever executive order from a president focused on care. And we've been working very hard on strategies in ACL around the direct care workforce through our Direct Care Workforce Strategies Center. We're really focused on that intersection of workforce and DSPs and family caregivers and how we can support family caregivers and some recent investments that we've made on implementation of the first ever national strategy to support family caregivers. We've been involved in lots of efforts collaboratively to expand opportunities for employment for people with disabilities, with several cross-agency guidances that came out last year. And then we've been working with so many of you in your own states on implementing the home and community-based settings rule. So that's just some of the many ways that again, because of your advocacy, we in the federal government have been pushing and creating momentum around home and community-based services. All of this is driven by the mission we have in ACL and really the mission of PCPID, which is that every person should have the opportunity to live where they want, to fully participate in community life, and to be valued. And with all of these positive advancements and the way that we are trying to move the needle, we know, and I know your report will point out the fact that we have a system of home and community-based services that is in crisis. People continue to have such challenges accessing home and community-based services. And we have an estimated 700,000 people on wait lists at their states for community-based services, and it's growing. The direct care workforce crisis has gone from a long-standing problem to a true emergency, with more than 3/4 of providers nationally turning down referrals and more than half discontinuing services altogether because they can't hire and retain staff. And from ACL's perspective, it is truly unconscionable for anyone who is authorized for services to not be able to get them. We are working very, very hard to make sure that direct support professionals are treated with the respect that they deserve and that their jobs are treated as the critical jobs that there are. And that means a lot of work collectively that we need to do around recruitment and training and retention of direct care workers. We know that families are having to take on more care and more complex care because of this workforce crisis. And again, that's another area where we are really, really trying to work and invest and address issues. Employment, another place where we have seen the huge increases over the last several years because of workplace flexibilities as a result of the pandemic and increased demand for workers. And we need to make sure we are able to sustain those gains, and also that we keep our eye on the fact that the workforce crisis also impacts the workforce that helps support people in workplaces. So it's going to take a sustained collaboration and advocacy from all of us, partnerships from across the federal government. And again, it is so important that we have these federal members here alongside the members on this committee from the community to make sure we are really using every tool in our toolkit to move things forward. The work of PCPID is absolutely crucial to our collective effort to advance change. And I really want to thank the PCPID work groups who are working on these critical pieces of home and community-based services and making concrete recommendations to the president, who will be able to really use that information to inform administration priorities and priorities across the federal agencies. I really look forward to learning from your combined wisdom, and we will be out there making sure that when your report is out there, that we are really lifting this up. So thank you so much for your hard work. Thank you for letting me join today to kick this off, and I'll now pass this to Jill Jacobs, ACL's Commissioner on Disabilities, to say a few additional words. Jill?
Thanks, Allison. Hi, everybody. I'll just describe myself real quickly for those of you who cannot see me. I am a middle-aged white woman with reddish brown hair pulled into a ponytail. I'm wearing a black suit jacket and I have on glasses with black frames. My My name is Jill Jacobs. I'm the Commissioner of the Administration on Disabilities. I want to thank everyone for being here today. I see we've got more than 200 attendees participating. That's wonderful. We love the public to be involved, to see the work we're doing and understand where we come from. And we love your input. So thanks for being here. I want to tell you how grateful I am and honored I am to be here today. Every time I work with the PCPID and I got to be in any meeting with PCPID committees or the whole membership is an honor. And I really appreciate you having me here today. I would like to talk a little bit, just briefly, because I've got 5 minutes. I don't want to go over that. So I'll be brief. But I do want to say something that I think is really important to know, that this committee, the PCPID, was created initially as a blue ribbon committee by under President Kennedy, so in 1961. And then it became a more formal committee under President Johnson after that. But in the 60+ years that this committee has been around, this is the first time that the majority of the membership has been people with intellectual and/or developmental disabilities. That is so valuable and so important, because the majority of the people who are here that give that share opinions and serve on the committees and the whole PCPID that make the decisions are people with intellectual and developmental disabilities. So I am I'm very proud of you all, of everyone, of all 34 members of PCPID. And in particular, I am proud of the people on this committee that make up the majority now, who have intellectual and developmental disabilities. I thank all of you for your hard work and your dedication to the mission you've been given, for accepting your appointments by the president to do this work. You are serving the disability community, people with disabilities, and you are serving your country. And I thank you for that. I'm really amazed and impressed that the topic that you all decided on 18 months ago, home and community-based services, is so on point. It's a broad topic. You tackled the big one, but you have the guts to do it. You have the dedication and commitment to do it. And you're totally on point, because as Allison mentioned, and you probably all noticed if you watch the State of the Union address, President Biden specifically addressed home and community-based services, or HCBS, or our waivers, as we tend to call them, my Medicaid waiver, in his State of the Union address. That's a big deal. It's a big deal to have a president talk about something so important to us and in any speech, but the State of the Union, those are valuable minutes. He's talking about what's going on in the whole country, and he talked about home and community-based services. So I'm so impressed that you all 18 months ago were already on point and already knew what was so important to talk about, what was so important to review and address and make commentary on to give that report to the president. You already knew. That's a lot of foresight. It's a lot of wisdom, and it comes from a lot of lived experience. So I'm impressed with you all. I've been impressed the whole time you've been doing this work, the past 18 months, and I continue to be impressed. You know, you all are working on this report. Your committees, your 9 committees have been individually working, and now you're going to be presenting to one another and 215 members of the public. Exactly what you plan to do. I'm looking for robust conversation today. I'm looking for interaction today. And I'm really looking forward to where this report heads. Of course, I'm looking forward to the publication of the report. I want to thank our chair, Jim Brett, who is just, fantastic and dedicated person doing this work. I thank Allison Barkoff for speaking today. I thank everyone who's played a role in this. Serena Lowe for coming on and helping with the writing, and our lead of our Office of Intellectual and Developmental Disabilities, David. You are fantastic. You're on point, and you keep this thing going. I look forward to the report when it comes out. Looking forward to the conversation today. Have a great meeting, everybody. Thanks for being here. And I'll turn it over to Alex now.
Thank you, Jill, and thank you, Allison, as well, and thank you for your leadership. Before we move on to the next introduction, I will be introducing David Jones in just a minute. I do want to make sure that I can announce the accessibility options again. There is ASL interpretation available. If you locate on the Zoom screen at the bottom, there is what looks like a ball or a globe at the bottom that should, if you click on that, that should make interpretation available. And there is also a button box with 2 CCs in it for showing captions. Those are available, and we want to make sure that that information is available to anybody who chooses to access them. So with that, I would now like to introduce David Jones. David is the director of the Office of Intellectual and Developmental Disabilities within ACL. In his role, David oversees the 56 state councils on developmental disabilities and 68 university centers of excellence, also known as UCEDs. Prior to joining ACL, David served in 2 federal agencies focused on disability employment. Over to you, David.
Great. Thank you, Alex. And Mr. Chair and members of the committee, on Wednesday, February 21st, ACL released a public announcement through a Federal Register notice about today's meeting. As part of that announcement, we also invited the public to share comment to the committee to help guide the committee's work. In summary, we received a total of 11 comments. The full committee already received all 11 comments in their entirety prior to today's meeting, but to ensure public transparency, I would like to briefly summarize those comments from a very broad, high level. There were a total of 5 comments made in reference to the topic of employment. One commenter was a parent of a 36-year-old son with profound autism and shared that there had never been any effort to include her son in any type of employment with the services he received and expressed much frustration. Most of the commenters emphasized the importance of choice. Some wanted to work in a competitive market, and some preferred more supportive setting where needs are met. There were 3 comments focused on caregiving, predominantly from aging parents, and the need for more federal and state support. One commenter was a parent in their 80s, describing how caring for their 50-year-old son with severe IDD with very little help. Another commenter was a mother of a 33-year-old son with autism, expressing concern on who will care for her child when she is gone. She recommended a waiver to provide for support services to replace parent involvement. Another commenter was a parent shared that being a parent of a child with autism involved a lifetime of difficult decisions that is not always understood by government agencies or disability advocates. And to support all of these families in this situation, one commenter commented that there needs to be more support for direct support professionals with higher wages. There were 2 comments focused on transportation. One commenter noted that transportation had been a big hurdle to get out in the community and seeking more direction and resources. Another comment focused on transportation gaps, especially in rural areas for those who want to work. And another comment focused on housing. This commenter was an aging parent and emphasized the importance of having a choice with housing, even if in group setting, to meet the needs and challenges of their child, as there was no other alternative. And one comment focused on medical training. The commenter noted that her son did not always have access to physicians with expertise in diagnosing and treating individuals who cannot communicate. In closing, on behalf of the committee, we would sincerely like to thank members of the public for sharing your comments with us. And Alex, I will pass it back to you.
Thank you, David. And with that, I would like to turn it to our final speaker here, Serena Lowe. Serena is the PCPID report writer, and Serena will be summarizing the report development activities to date. Serena has spent the past 25 years furthering public policies that promote the socioeconomic advancement of individuals with disabilities, older adults, children, low-income working families, asylum seekers, and other at-risk populations. Serena served in multiple leadership roles, both inside and outside of government. And with that, I'd like to turn to Serena.
Good morning, everyone, or good afternoon, and greetings from beautiful Sedona, Arizona. It has been a pleasure and privilege to serve the committee and work with the committee membership over the past several months as they have put such intentionality in their discussions and in their efforts with respect to this important topic. I will walk you through right now in just a brief moment, a brief few moments. My intention is to really walk you through and describe the breadth and depth of activities that the committee has undertaken, again, over the past several months to identify the challenges that face the provision of home and community-based services, and to identify appropriate policy strategies and recommendations for improving our systems and the overall outcomes for individuals with intellectual disabilities and their families moving forward. You can go to the next slide, if you will. And again, I'm just going to walk you through very briefly some of the work that has been done to date. As Chairman Brent has noted earlier, there are 4 work groups that the committee's membership participate in. And each of these work groups have met several times to identify the policy challenges, the barriers, and proposed recommendations that would be prioritized in this report. I will want to highlight that in addition to federal policy recommendations, it was important to the committee understanding that most of this work of these home and community-based systems, while funded by the federal government, are implemented at the state level. So it was really important to the committee to also identify strategies for states and their provider networks to take, and to identify and highlight innovative models, promising practices, and most importantly, human narrative stories to be integrated throughout the report. Those human stories show and demonstrate the wonderful power, contributions, and benefits that we all receive when individuals with intellectual disabilities and their families are truly and meaningfully engaged and fully included in our communities and in our society. Next slide, please. In terms of the format of the report, the beginning of the report will talk through why the committee chose the topic of home and community-based services and what some big learnings have been over the past several years in this space. The space has been changing with numerous and major dynamics going on in our world, everything from the public health emergency to the first ever introduction and implementation of a federal regulation to govern and assure that there are minimal criteria that must be set for all Medicaid-funded home and community-based services. So we'll talk through some of those changes and what we've learned over the past several years. And then we will talk about some overarching issues that each of the work groups have highlighted, including the importance of investing in training, technical assistance, and ongoing coaching support to help empower self-advocates and their allies to be not only informing, but driving the direction of federally funded home and community-based services in the future, the role of technology and the importance of using technological supports and leveraging technology with integrity, and most importantly, looking at the intersectionality issues across these various systems and making sure, again, that individuals with intellectual disabilities and their families are fully engaged in decisions that affect and impact their everyday lives. From there, each of the work group sections will provide an overview of each of those work group topics. We'll discuss the policy challenges that have been identified as the top priority challenges, not an exhaustive list, but the most important and salient ones for federal policymakers. We'll discuss recent investments to address these challenges. And with that, I want to acknowledge the powerful and tremendous contributions of our federal partners during this process in each of the work groups. Then there will be the proposed federal policy recommendations and state policy recommendations that you will hear about more today, as well as a spotlight on innovation and the human personal stories by which none of us would be here if these people were not here with us today. And on that, I think I will turn it over to Alex. And again, just want to thank the chairman, the ACL leadership, David in particular for his tremendous support, and most importantly, the work, the intentionality and the commitment of each and every one of the members that are serving on the committee today. It has been a pleasure and a privilege to serve you in this role.
Thank you, Serena, and thank you for this overview and for your work to date with all of the work groups. At this time, we are going to turn our conversation to the first of the work groups. We will have 4 work groups work our way through this discussion. The first one is focused on the direct support professionals, work group, policy challenges and recommendations. This is the same structure we will have for each of the work groups. There will be a brief presentation by the work group chairs, and then we will turn to a full committee discussion, which will begin with an opportunity for the members, other members of the work group to provide a comment that would be adding on to or adding a little bit of additional information related to any of the challenges and recommendations that are identified. And then also, we will absolutely then be turning to the full committee for comment and feedback. What's important to know is that where we are right now, we are looking for discussion and description that is really providing additional information, and then we'll flesh out the ideas that are really laid out here. So with that, I would like to turn to the first of the 3 chairs of the DSP work group, and that is Tia Nellis. So over to you, Tia.
Good morning or afternoon, no matter wherever you're at. First, my name is Tia Nellis, and I was a co-chair of this work group. And I would like to thank our other 2 co-chairs, Nicole and Joe, for being a part of this group, and our members, Kara and Kathy and Hillary, Wendy, Jody, and Liz, for all your participation and hard work on helping us get together, and all of your comments, and you're working on this work group as a team. And now I would like to turn it over to Joseph Macbeth.
Thank you, Tia, and thank you, everybody. You can go to the next slide, if you would, please. Again, I'd like to thank all the members of this work group, and thanks to ACL staff and consultants for their support that we've received over the past few months. There's no doubt that building a competent and stable workforce is a key linchpin to success of home and community-based services. It is indeed the one common factor that runs through all aspects of community life for people with intellectual and developmental disabilities in every community in this country. As Allison mentioned, industry stakeholders report that we are at a tipping point of crisis proportions due to ongoing challenges of recruiting, developing, and retaining direct support professionals. This has always been a challenge, but especially so in a strong economy with less than 4% unemployment rates. The lack of a competent, qualified, and reliable workforce is negatively impacting the IDD system. to the point of programs being closed, providers unable to serve more people, and the endless and expanding waiting list for services for people with disabilities and their families. But make no mistake, this is not a crisis. A crisis is sudden, unexpected, and temporary. The President's Committee for People with Intellectual Disabilities has dedicated 2 previous reports to the President that were solely focused on addressing our workforce failures. The first of which was nearly 30 years ago in 1996. And again, the most recent report in 2017. Both reports provided sound recommendations that could have begun to address this crisis years ago. Furthermore, the workforce challenge is well documented. There have literally been dozens of reports to elected officials, policymakers, academic papers, direct support professional surveys, and advocacy appeals from people with IDD and their families that informed us that the status quo was unsustainable. For decades, we have understood the workforce challenge, and sadly, as an industry, we have been admiring it and have done little to address it in a systems change effort. Therefore, it is most certainly not a crisis. It has become a systemic failure to adequately invest financial resources into one of the most important elements of community life, the direct support professional. The one thing that we did not see coming, however, was COVID-19 and how a once in a century pandemic would impact the everyday lives of people with IDD and how unprepared we were as a system in protecting them from a deadly virus. I suppose if there was a silver lining to the COVID pandemic, it was the lifting of the veil of how essential and critically important the direct support professional workforce was to promoting physical and emotional well-being during a true crisis. Direct support jobs focus on all aspects of community life. Then in March of 2020, the community closed, and almost overnight, direct support professionals had to redefine and reimagine their jobs. Now, for the first time, due to their unrelenting work, our workforce is receiving serious attention at the very highest levels of government. So let's seize this opportunity. Thanks to the American Recovery Plan Act, nearly $37 billion was invested into home and community-based services. Many states have used ARPA funds to address their workforce shortages. But ARPA funding was and is only a short-term solution. States should have carefully identified and invested those funds to inform us on what long-term solutions can be implemented to finally address the complex workforce failure. Sadly, many states did not. We have an opportunity before us to finally get this right. So with that monologue out of the way, let's review some of the formal challenges that will be identified in our committee's report to the President. 1, the shrinking DSP workforce pipeline continues to amid growing demand for home and community-based services. Compensation, wages. Make no mistake, a living wage is vital to recruiting and retaining DSPs. But what's a living wage? To quote President Franklin Roosevelt, by living wages, I mean more than a bare subsistence level. I mean the wages of a decent living. A recent report from Miami University shows that low pay is causing nearly half of New York's direct support professionals to experience food insecurity and unstable housing conditions, all while providing critical life supports for people with disabilities. Furthermore, low wages disproportionately affect women and people of color, the majority of the direct support professional workforce, according to this study. This is a social justice issue that demands our attention. According to the most recent State of the Workforce report that was recently released by the National Core Indicators, all 24 states that conducted the survey in 2021 had an increase in median hourly wage in 2022. National median wages has increased by $1.50 an hour from $14.50 an hour in 2021 to $15.98 an hour in 2022. A small step in the right direction, but clearly not a salary commensurate with the duties that direct support professionals are expected to perform. Poor business acumen and the workplace culture. Improving workplace culture by improving the skills of our frontline managers, frontline supervisors, and building future leaders for this field. Direct support professionals are often promoted from direct support positions into management positions, not because they're good managers, it's because they're good direct support professionals. And we want to keep them. They're often unprepared for these new jobs. They're often overwhelmed and overworked. They often set the tone for the workplace culture of their work sites, and they are responsible, in many cases, the dissatisfaction, high levels of turnover among their direct support professionals. We need to build a more person-centered approach toward direct support professionals from a system that speaks a lot about being person-centered. This is an investment in our system's future leaders. The lack of sophisticated marketing, recruitment strategies to expand DSP's the pool of potential direct support professionals. We need to work with high schools and community colleges to expose potential direct support professionals to these career opportunities, but they cannot be leading career opportunities into poverty. Just yesterday, New York Governor Kathy Hochul announced a $32 million investment to expand the direct support professional micro-credentialing program, which will be highlighted as a best practice in this report, for partnership with the New York State University school system and the Office for People with Disabilities that will help educate 6,000 students and grow the direct support professional workforce to support New Yorkers with developmental disabilities. There is no reason why this cannot be replicated by other states. Number two, the lack of professional or career pathways for direct support professionals discourages workers from remaining in the field. We need to identify a unique labor category classification for direct support professionals. They are often anonymous and categorized with other caregivers. While all caregivers provide essential supports and services, and all caregivers are critically important, they are not all alike and have completely different skill standards. For us to protect future needs, we must secure a unique professional identity through a standard occupational classification granted by the Bureau of Labor Statistics. Once secured, we can begin to collect robust workforce data and project future services. I'm happy to report that just last night, the Role of the Direct Support Professional Act, Senate Bill 1332, was passed in the United States Senate. So we're making some progress, but there's still a long way to go. The lack of professional standards leads to a fragmentation in service delivery. We have to improve and raise the bar for training of direct support professionals. Training must be based on core competencies and real aspects of their work. We need to keep incumbent workers in this profession by creating career ladders for them to objectively demonstrate their skills, their values, and their performance, and provide them with incremental wage increases in their hourly wages. These are the people who are vital. They've built relationships with the people that they support. We cannot afford 40 to 50% turnover of these highly valued workers. We need to create career ladders. What we're asking DSPs to perform on day one is often complex and highly individualized. When we hire direct support professionals and have them begin working, they must be prepared. It takes time to become a competent direct support professional. They need to have the grace and the luxury to practice their craft. Next slide, please. The disparities with supply shortages versus the constant growing demand requires other solutions to address these gaps in HCBS. And you know, despite these technological interventions, we need to find technological interventions that supports the workforce. There is a limited number of people who can and are willing to do this work. Let's find the technology to make them become more able to do their jobs. And finally, preparing the direct support workforce in self-directed models is just as important, perhaps even more important, due to their professional isolation, the requirement for their independent judgment making, and person-centeredness. Lastly, before I turn it over to my colleague and my friend Nicole Jorwick, the over-reliance on family caregivers has created a tremendous burden on families. And we need to increase respite services to allow family members to have a break. However, the staff who are working in those respite services need to be highly trained and highly compensated for their work, because you're dealing with so many different people. It's easy for me to list out the challenges of this work, of this particular chapter in the paper. I think what Nicole Jorwick is about to share with you is the real work. What are we going to do about it? So I'm going to pass it over to my colleague, Nicole Jorwick.
Thank you so much, Joe. And we can go to, well, this slide I do want to show. This is, it really highlights the wide variety of work that the expectation and that is actually happening with direct support professionals on the ground. This is something for folks that don't know me, I work on these issues professionally, but also I am a family caregiver to my brother, Chris, who has autism and who has not had a direct support professional, who we are not related to since the pandemic began. And that is a really common scenario. And it's something that we need to be working for when we're developing these solutions. So we can move to the next slide. And Joe touched on some of these pieces, so I won't be redundant, but
a career pathway. So making sure that this
is good about saying, you know what is a career path that I want to go into is becoming a direct support professional. And that not only is that a good entry-level job with good pay and good benefits, but that there is a career path and a career ladder when it comes to these jobs. And that also will lead to making sure that we have a DSP pipeline. And when we're talking about a pipeline, what that means is we want to have places in community colleges and in other places where we have a group of people that we can go to that want to become direct support professionals that can become a pipeline into the system. And also, again, that builds onto the first recommendation, because we want to make sure that those jobs are good jobs to go into. It's also incredibly important that we're diversifying workforce solutions to adequately meet the growing demand for home and community-based services, and making sure that that's always done in a person-centered way, and that the people who direct support professionals are serving is at the center of that. We know that there's going to be a lot of shifts in technology and in access, but we're going to always continue to need the human infrastructure of direct support professionals to ensure that the agency and independence of the people receiving services are at the center of the work. We can go to the next slide. As Serena mentioned in her remarks, there's incredibly important work to do at the federal level in terms of ensuring that we're increasing wages and creating a standard occupational code and collecting data and making sure that there is funding for these creation of the pipeline programs. But we also need to make sure that states are also putting the investments that they need to and the structure that they need to continue to expand access to direct support professionals. So implementing new approaches on incentivizing and hiring, investing in the professionalization and career advancement of DSPs, just like we were talking about at the federal level, and models that empower experienced direct professionals to lead in the development of new models, and also to support those folks in management roles, which, as Joe laid out, is incredibly different work and is incredibly important. One thing to name is Joe mentioned the $37 billion that came in through the American Rescue Plan Act that was temporary funding that is set to expire next year. And what that also was a lot of money flowing out the door for a lot of states to try a lot of different things, which is wonderful because what that means is we have a lot of data and states have a lot of data on what works, what worked sort of well and needs to be tweaked, and what didn't work at all. And so it's also incredibly important that states are looking at, because the really something that shows the huge need for home and community-based services and the direct support professional workforce in general is the fact that every single state took up this temporary funding. And so it's incredibly important to look at the successes and the challenges of that funding to make sure that we're highlighting the best practices and also as we continue to push for more long-term funding. So those are just some of the recommendations that you'll see in the final report. And at this point, I will turn it over to Tia, and then I know we also will have time for questions.
Yeah, I just wanted to state again how important it is to include people with intellectual disabilities in all steps of this work, not only in the part of direct support care workers, people with disabilities wanting to be direct support care workers themselves, being able to have that training and a way to be able to do that, but also in HCBS as a whole. And the voice of people with disabilities is really important. And I think we need to make sure that people with disabilities know what HCBS rule is and how to advocate for it and to use their voice and to play a role in every step of the way that we are doing this. And it's a good start that we are having a lot of people with disabilities as a part of this on this call and being a part of the President's Committee to help have their voice heard. But it's also important that we remember that there are a lot of people with disabilities out there that this is going to affect their lives. And we need to be helping them speak up and learn about HCBS and how to make sure that they are getting their voices heard and out there. Thank you. Now we're in discussion.
Yeah, and also if there's any other work group members who wanted to say anything that Joe or Tia I might have missed, we also wanted to make sure we made space for those for you all. And then also questions.
Thank you, Tia, Nicole, Joe. So yes, as Nicole just said, we are now in the open discussion part of this portion of the meeting. We're looking forward to hearing from both work group members if they would like to add to the remarks. They're welcome to, and I do know that this is a good time for people to ask questions as well or provide additional commentary for discussion. As a reminder, you can put your comments into chat for the committee members. You can also raise your hand, as I see Liz Weintraub has just done. So let me turn it to you, Liz, for discussion.
And hi, this Liz Weintraub. I'm a member. And thank you, Joe, Tia, and Nicole for a great report. My question is, and I know because I'm in the policy field, there are several legislation that are out there that might help relieve this issue. And have you how will that help? Can we move Congress? Can we help relieve that issue by having Congress pass those important legislation?
Yeah, that's a really, really great question, Liz. And so there's several pieces of legislation that could help. Joe mentioned the standard occupational code bill, the recognizing that a role of direct support professional bill. It did pass the Senate. So now it needs to pass the House, and then hopefully we know, or not hopefully, we know that that the president would sign the bill. That's a really good start because that would allow for some data collection, which is incredibly important. But there is additional legislation. There's the HCBS Relief Act that would include 2 years of funding, just like the American Rescue Plan Act included 1. So it would theoretically double that investment. And there's also major pieces of legislation like the HCBS Access Act that does have workforce components, and also would eliminate waiting lists. When it comes to home and community-based services, that's kind of like a huge goal that would also have a huge cost because of how many people are on the waiting list. So there are a lot of different pieces of legislation that are out there that it's really important that we're all sharing the stories of direct support professionals and people with IDD who require these supports. Because as you know, Liz, from advocating on the Hill, those are the stories that are going to make the difference. And also we do have all this really strong data from the American Rescue Plan Act investments to also show as to how this money really helps people, really helps workers, and is so needed, as I said, because every single state took it up. So good question, and happy to share more about those pieces of legislation. We can do that through email later. And I know you know them, Liz, but I can share them with more widely.
Thank you for that question and for your answer, Nicole, as well. Next, I see Kathy Kanofsky with a question.
Yes, thank you. I just want to again applaud the work group and the report out. You captured everything that we've discussed for quite a while so well. And as I was listening to you talk, especially Joseph, talking about some of the things that we had kind of gone round and round about, and then being able to point to the success in New York. Just last night was just so fun, and what to me that makes kind of puts another level of responsibility on this committee to be on top of what is happening throughout the country, so that we can grab it and share it and push that out as examples for other states to adopt. But what struck me the most, and I remember having this conversation, and I love the fact that you stressed it so much, is not to promote direct support professionals just because they're the next in line, or maybe possibly because they've been the longest on staff, because I feel like that has been something that as a family we've experienced time and time again. Something that was really great in that role is now being put into a management role. You can put that's something that is transferable across so many different careers, that people move into management just because they're the next in line. And I think that's just something that we need to truly lift up, that somebody that's managing direct support professionals has a different skill set and has to have specific training. So thank you for pointing that out.
And also making sure that wages for all direct support professionals are high enough so that folks don't feel like they need to take the management role just for that additional $1 or $2 an hour. So absolutely, yeah.
Thank you, Kathy. Next, I'd like to turn to James Metters. You have your hand up.
I'm going to use my passive voice to share what I'm feeling. We have great ideals, but a certain person who's the head person in Austin, the governor, and certain congresspersons, senators, and representatives would not support this for the people who we really want to help. What I mean is that Greg Abbott would not support it, the legislature would not support it, Ted Cruz and John Coleman would not support it. Because if we just ask the states to require it, it would not get it done in Texas. It's so embarrassing for me that some workers get only $9 an hour, and other people get the CDS option, consumer directed services, get $20 an hour. what's wrong with this picture? And it just makes me mad and angry and sad that we have great ideals. Instead of an option choice for states, I feel like it needs to be in law in place instead of a recommendation. Because we have a dual system here in Texas, we have 13 state-running institutions. We have about 20 to 30,000 people who are waiting for home community-based services. The last increase of a waiting list was only 200 slots, not 200,000, 200 people, and broke up in different regions. And we have 254 counties. Imagine the local authorities get only 200 waiver slots that in competition one another to get the funding, to get the home community-based services. And the providers are not really there for us. They're in it for money. And it's a lot of for-profit business and residential money programs, because I noticed in group homes in Texas, it's for-profit business. If you go to community living, it's the not-profit world business. I don't want to say recommendation. I think it could be a policy-making thing instead, especially those who are states are not willing to help us and don't want to support us. And that's what I want to say, because I'm just angry. I'm not mad at the committee. I'm just mad at the system and states who will not support us.
We certainly hear you, James. I was wondering if some members from the DSP from the Workforce Committee would like to reflect on some of the the variability that James is describing by state and in the systems.
Yeah, James, first of all, hi. And also feel that frustration deeply in my soul. Also being from Illinois that has very low wages and high waiting lists. It's something that I know personally as a family member and a former state level advocate. And that variation in the state level between not only the wages, but also what's available, how big the waiting lists are, is the fundamental problem in our system, and it drives disparity. And so why I kept harping on the fact that all 50 states took up that money is because that's what we need to see, and we need to create a federal floor. That's what James, when you're saying what you want is a law, what we need is a law that would create a federal floor for things like wages and also services that are available, so that whether you live in Texas or Illinois or Oregon or Massachusetts or wherever you are, that you know that you can have those services. And also people move. And so there needs to be that sort of federal floor so that people can move. The bill that would do that is the HCBS Access Act, which is also going to be very expensive, but it's what we can fight for. And it's a bill that's out there already. It's not a bill that we need to get introduced. It's a bill that has been introduced. And so it's incredibly frustrating, but there are solutions out there. And if we can all join collectively, I truly believe we can win, because as Joe said, and Allison said, and Jill said, this is the time is now where this is getting national attention. And so that makes me think we can win.
How we could get people like Ted Cruz and John Corbin don't want to support whatever this administration doing. Because we don't have no choice of senators until this November. We could vote him out, but people have been waiting a long time, and red states against blue states, and it's real. I'm not making it, it's real, and it's just nerve-wracking.
Joe, I see you have your hand up just in response.
Very quickly, I think, James, you don't need me to tell you this, the power of advocacy is strong. And I think it's going to take a whole lot of advocacy at the state level to make those changes. And I think you show that leadership yourself. So thank you.
Thank you, Joe, and thank you, James, for bringing forward your remarks. I want to make sure that we have an opportunity to hear from a couple other people who have their hand raised. Next, I see Kara Jones. You have your hand raised. Kara, I think you are still muted. Let's see if we can unmute. I think I'm going to need to ask Census to unmute Kara's line. Thank you. You're unmuted now, Kara.
Well, you don't come. I have a what she doesn't come. I people how this stuff. So it's gonna help you be like, no, I don't want that. But I want this.
So, hi, this is Kara's mama, and I think what she's saying is that when her DSP doesn't come to work, most times the agency will send a substitute, but the substitutes are never trained on Kara's particular needs because of her disability. And I end up basically spending my day training the substitute who just comes for maybe one day. So I think, and I might have missed it. Someone came to my door, but it's really important that when there are substitutes provided, that they're trained as well, not just the DSPs. Just speaking as a family caregiver. Thank you.
Thank you for that important remark. I think this is, Kara, you're a member of the work group, and we really appreciate you jumping in. I see that in chat also, yeah, Joe Macbeth also noted, yes, we recognize that is a real issue, Kara, because certainly with a lot of turnover in the workforce, substitutes who don't really have the training or knowledge are often called into place.
I have to call the people to help me get my own. The care for one day, 1 month.
Because, well, oh yeah, well, yeah. She has to call other people to help because they are reluctant to do some of the physicality involved in caring for Kara, like, you know, helping her with transfers and that type of thing. And they're not trained.
They're not trained. Ew. All the people be like, can they pray for life? I'll be like, I don't know who's coming.
Yeah, we're fortunate, but you know, to even get the services, but there's so much more to be done that was outlined, and those were excellent reports. But it doesn't make sense when people are coming and getting paid and they don't know what to do. And that's all. Did you have something else?
No.
Thank you.
Thank you.
Thank you, Kara, and thank you for bringing forward these important remarks. Absolutely. We have one other committee member with their hand raised, and that is Sean Elion.
Yes. First of all, good afternoon to my fellow PCPID members, to to everyone that joined us today. I have a couple of things. One, let's just state the fact. A lot of DSP members, workers, are African American, so therefore they are low paid. Secondly, a lot of times they don't even have the white benefits. And I also want to ask the community, do y'all have a plan just in case a emergency come up again, that this won't happen? And what else that needs to be done to address this crisis? Because I feel like this is a other form of ableism that need to be knocked down in our country. So thank you.
Thank you, Sean. So a couple-
And how can we make sure, going back to Kara's point, if they not trained, then why are they sending these people out that don't have no clue how to take care of the continent? And basically where all come down to, it's a human right that not being met with care and attention. Thank you.
Thank you, Sean, for your comments. I heard your last comment was about training and the priority to focus on training for all. Certainly. You also raised an issue, a couple other issues. One about a plan in case of emergencies, and I think you were referencing the pandemic emergency, and is that right, in terms of that being a particular issue to be addressed. And then your earlier comment was making the point that in many cases, direct support workers are on Medicaid themselves, and in many cases are, have low incomes themselves, and how that can be something to really be paid attention to.
Yes, and most of the time they are African Americans that is doing this type of work. So then you have a other oppressed group who try to help a other oppressed group, and both groups of not being helped. Oh, okay. I'm going to stop here before I didn't go on and on. But thank you.
Thank you, Sean. I see, Joe, you've got your hand raised, so let me turn it to you, Joe.
Thank you, Alex, and thank you, Sean. Listen, as I mentioned in my opening, we have been studying this for decades. This was an easy chapter to write. It's been written time and time again. And when it comes down to it, it's a matter of resources, financial resources. When institutions closed in the 1970s, we built community living on the backs of the direct support workforce. We told government that we could do it cheaper. And we're doing it cheaper by paying direct support professionals poverty level wages. And we have to confront that and be honest about it and implement some of these changes. I want no part of writing a report where the recommendations are sitting on a shelf. Thank you.
Thank you. Thank you, Joe. We are just about at the total amount of time that we have for this discussion. Liz, I did see that you have had your hand up for a while, so I would like to turn it to you if you have if you have a quick remark to make.
Yeah, Joe was saying that we have done this over and over again. And if people want people with disability to live in the community, because we all know that it's cheaper to live in the community than in institutions, and it's better and safer. We learned safer during the pandemic. Then why are we still talking about the DSP crisis? Because we need to live in the only way that we can live in the community, and when I say we, I mean people with disabilities, we need support to live in the community. So I would think that people would like us to live in the community, but they're not, because they're not helping us to live in the community. And people are saying that if we don't solve this issue, I thought I heard that institution can be reopening for people that need to have support. So, thank you.
Thank you, Liz. And I think that gives you the final comment on this discussion. And your remarks have been a strong, your final remark is in strong support of home and community-based support ongoing. And we'll be talking more about that as we move into the next sections. Before we do that, though, we will be taking a break. We will be taking a 10-minute break, and we'll be coming back after 10 minutes with the next section for discussion that will be focusing particularly on the employment, on issues specifically around employment and people with intellectual developmental disabilities. So with that, let me say we will be taking a 10-minute break. Thank you everyone for joining us, and we will be back. Hello, everyone. Welcome back. We are moving on to the second work group discussion of the PCPID. And in this discussion, we will be moving on to a discussion with the work group members focused on employment. With that, I would like to turn to one of the committee members who will be speaking, and also another committee member chair, Gabe Martinez, along with Kathy Konevsky. And I think Kathy, you will be taking this first section. Is that right?
I will. Thank you. So thank you so much for having me. I'm filling in today for Eva, who has done such a fabulous job co-chairing this committee and unfortunately was not able to join us today. So I'm going to hope to be a stellar mate to Gabe as we get through this next presentation. I'd also like to thank the other members of our committee, Elise, Adam, Lena, Max, Brent, Lucy, Heather, and Nick. You could probably go to the next slide. Just want to, before Gabe takes over on this slide, just a little precursor. So we know from a lot of our feedback and the comments that we received, and certainly just through discussion with our own committee, when we talk about competitive employment, and we talk about the range of folks that are looking for employment through with ID, we know that there's a wide range of capability, a wide range of need, a wide range of services and support. And that has been something that has come out before. There are some people that need quite a bit of service and support. There are some folks that are a little more independent. And we tried our best to look at through the lenses of all the people with intellectual disabilities that are seeking employment. So Gabe, it's yours.
Thank you, Kathy. For this slide, it's called Keyboard Sources Reference means advisory committee increase in comparative integrated employment for individuals with disabilities in 2016. That report addressed calls like overall capacity building with youth, and building capability with marketplace, and capability building and decreased allowance on selection 14C, special wage certificates, capability building with for building like credit indices, like different things that we discuss and what they need, and that we can support each one of the addresses that we announce. We can go to the next slide for Kathy to discuss more things about this.
This is Kathy again. Am I muted? Somebody said I was echoing before. Am I okay here?
We can hear you, Kathy.
Okay, thank you. So it's the next slide, please. So key challenges. In talking through the key challenges that prevent some folks from getting competitive integrated employment, and I'm just going to, for the sake of not saying that three-word phrase throughout the next couple of minutes, I'm just going to refer to employment and hope that everyone knows what I mean. In April of 2019, the U.S. employment rate dropped to 3.6%, which was the lowest in 50 years. The unemployment rate for those with ID is twice as high. I'm sorry. So that's me. I'm having trouble clicking one. It's not letting me click my video back on.
It looks like you've got your video back.
Okay, there you go. Thank you. The unemployment rate for those with ID is 2 times higher than those without disabilities. In 2017, only 20% of workers with ID had real jobs for real pay. And surveys show that people with ID want to work more than they are currently employed. There's a lack of private sector employment opportunities for individuals with ID in the nation's economic mainstream. And the National Core Indicator in 2018 survey, we found that only 20.2% of those with ID got services and who got services were doing paid work. And nearly half of those same people wanted to work. Data shows that more opportunities are needed for people to get service, to have jobs. We must support people at work so they can be successful. It's pretty simple. Employers need help finding and funding unique supports that workers with ID need to be successful in their employment. Examples include embedding job accommodations, customized employment practices and strategies. States have a hard time organizing services and resources across systems to support individuals with ID to get a job. And I think this was a point that was being made earlier. The state-to-state shift in employment participation among people with ID proves that state policy and investments have a big effect on how many people are working in integrated settings. And unfortunately, there's a lack of funding to increase access to inclusive apprenticeships or other training opportunities for individuals with ID. There aren't supports available to help workers stay successful in the job. So sometimes they get the job, but then as we talked about with the direct support professionals, if you don't have the job coach that's steady and consistent and knows you and knows how to support you, that doesn't bode well for being able to stay successfully placed in that position. Benefits planning is essential too, and we're going to talk about that in the next slide. So turn it over to Gabe again.
Okay, this one is proposed federal policy recommendations. Number one is building capability among employers, like established by initiating clear house resource so that employers can more easily accounted information about concrete and cohesive plate like platform challenges and supports and promising practice in disability, employing people with disabilities, provide federal funding and offset costs, offered by private employers to hire internal jobs, coaches and other costs associated with time, employees, like spend and provide ongoing on the job supports on board and maintain employees with IDD and promote fun and exclusive appearances like internship, work-based learning opportunities, and like offer tax incentives and interactive employers and employed people with IDD and unique recruitment and hiring practice supported employment strategies and hiring and like internal staff to support employees with IDD and on commissions and strengthen and assist like efforts like prevent and make workplace and discrimination against individuals with IDD and manage employers about the business benefits in hiring coworkers and disabilities. We can go to the next slide for Kathy. Kathy has 2 slides for you to get these correct.
Yeah. Hi, and actually, can we go back? We're going to flip back and forth because we were going over the actual challenges and then switching to the recommendations associated. Because can we go back to the previous slide first? Yeah. So another one of our key challenges is the benefits planning to ensure that people with sustained employment and advancement can actually have their benefits. So workers with disabilities need help learning about the various rules around earning and saving money so that they don't get into trouble and jeopardize their health care or their important benefits simply because they're being paid for a job. Employers and vocational rehab coaches and workforce development specialists also need to have that knowledge about benefits pay so they can help support their workers with intellectual disabilities. And then people helping people with ID seek employment isn't always a government priority. So we know that. More Medicaid funding is spent on day habilitation and sheltered work than supporting people in competitive integrated employment. Through Medicaid waivers, state and federal governments spend approximately $500 million a year for segregated day programs. States spend slightly less than $100 million per year to support people with disabilities to participate in employment. That's less than 20% of what is spent on day programming. And despite 20 years of documented evidence-based around customized employment, many state waiver programs still do not provide customized employment services. As a result, many providers have not invested in staff training to adopt customized employment or other best practices. Many families of individuals with ID have reservations about employment because they fear their loved ones with intellectual disabilities will be harmed in the workplace or will lose important benefits. And I didn't introduce myself with my several hats in the beginning of this, but this one strikes home for me. I'm a mom of twin sons with autism who are in their 30s. Both are employed. One of them lost his Social Security after moving into a living wage of $18 an hour at 20 hours a week. So he made too much and he lost his benefits by that move. Luckily, you know, this is what we talk about here, right? They both live with us and they don't live on their own. So we support them. But if he were on his own, losing his benefits because he was making $18 an hour, $20 a week is not what any of us are hoping for our loved ones. Last challenge here is individuals with intellectual disabilities who are interested in starting their own businesses. According to a report by the National Disability Institute, approximately 1.8 individuals with disabilities are business owners. Entrepreneurship offers an alternative path to traditional employment for individuals with disabilities. I think we've all seen really cool examples of folks starting their own business, whether that be with several other peers with disabilities or a family member that helps them get started, coffee shops and car washes and all kinds of really neat businesses. But over twice as many Americans living with a disability turn to those kind of small business opportunities than people without disabilities. So there's something there. The federal government does not provide many resources or training to support people with intellectual disabilities who wish to start their own businesses. So if you read between the lines there are several of us helping make that happen. So we can go to slide 5. I'm sorry, slide 6. Thank you. So continuing with the recommendations that were made based on those findings, we are looking to propose that the White House issue an executive order in the first 100 days of the final report. And that federal executive order can ask states to adopt employment first models. A move like this signals a major policy change for public services. It sends a strong message that we are serious about having high expectations for people with disabilities. An executive order can mandate federal agencies adopt a policy on employment first. The executive order would build on the Workforce Opportunity and Innovation Act and help job seekers access employment, education, training, and on-the-job supports. Hold states accountable through reporting metrics tied to federal funding to demonstrate increases in employment outcomes. So we need to look at demonstrating those employment outcomes for those people being served in various systems, including the waiver programs, state vocational rehabilitation, Department of Education, IDEA, Part B transition funding, and employment and training fund to state workforce development agencies. We need to invest more federal funding and state efforts to training our providers to focus on customized employment and individualized supported employment. We need to build capacity of federal government as a model employer of people, workers with ID, increase the percentage under existing rules requiring each federal agency to adopt a goal to hire more people with targeted disabilities, invest in federal hiring campaign of individuals with targeted disabilities, and invest in specialized training and outreach designed to serve the needs of people with ID, for example, on providing reasonable accommodations in the workplace. We need to issue additional guidance on how to support people who have high acuity and intense support needs. And that goes back to some of the comments that we've heard. You know, we're not looking just to provide support for someone who can very easily and independently get to work, be there, spend the day there, get on the bus or get in a car and go home. We need to make sure that those that need extra care and specialized care to be successful in the workplace get that as well. Additional investments to elevate focus on employment outcomes for Native Americans with ID living in sovereign tribal communities. The federal government should learn what the needs of the individuals with ID are who live in tribal nations, and they need to provide funding to support these communities to pilot different ideas for helping these individuals develop their skills so they can find a job. And go on to the next slide, please. That was you, Gabe.
Okay, this one is proposed federal policy recommendations, called building capacity and improvers in the small business and innovators with IDD, like promote SBA loans, information labs that focus on IDD specific entrepreneurship, like increase disability funds, financial assistance, like DFA awards, about in community development and investment funds, like provide federal funding and support training, technology, assistance and resources to specify add small business and owners and entrepreneurship with IDD that support bipartisan recognition institution in late 2023 that supporting Disabled Enterprise Act and or similar initiatives actions by SBA to establish a coordinator like for disabled small business concerns at agencies collect voluntary demographic data from program application like
It looks like the screen, Gabe, are you still seeing the slides, or did the slides just disappear for you?
disappeared.
There's a tech issue on the back end. Just a moment.
Apologies, everyone. We're having a brief tech issue, and we'll have this addressed and picked up quite quickly. While our census team is supporting the tech issue, oh, here we go. They're right back. And over to you, Gabe.
Thank you. For the disability status and provide police data and application like disabled employers like SBA programs that we discussed like last time and this time and goes on. Thank you.
Okay, me. And so this is the last slide of recommendations. We're recommending the employment first, which we talked about, the first 100 days upon signing. We're looking to prepare and incentivize the providers to expand more evidence-based employment services for individuals with IDD, and then to become the model employer. The supporting employers of individuals with ID, establish local and state incentives to cover additional costs of training and supporting workers with IDD to successfully engage in competitive integrated employment. State employer promotion campaigns, whatever we can do to promote these campaigns to support additional work, additional programs, additional supports in terms of training. We want flexible funding partnerships between employers and all the different agencies that help us make sure that we are doing whatever we can to offset this cost of hiring internal staff. So we know, the landscape of what we're talking about right now as of today, and hopefully, not too long for now, but right now we're not able to necessarily rely on outside agencies to provide the support, the consistent support that job coaches provide. So how do we incentivize employers? What can we do to help employers cover the cost that basically it's taxing on their business or their nonprofit or whatever their organization is, to be able to provide the supports and the infrastructure internally so that consistent, steady support is available to someone that's coming to work for you. And then we also want to make sure that we're providing and promoting small businesses and entrepreneurs to be able to take the following steps to promote individuals who wish to start their small business or become an entrepreneur. As I mentioned before, there's so many cool ideas out there, and there are a lot of things that people with intellectual disabilities are very, very, very capable of. One of them for sure is actually having a vision, seeing who's needed to complete that vision, pulling those folks in, and creating an opportunity not just to work, but to impact the environment as a whole. And so we need some grants or long-term loans with favorable terms to individuals with IDD to be able to take advantage of an opportunity and try that business and see how it works, and then offer the specialized training and technical assistance to support the potential entrepreneurs with IDD. And that is the end of our policy recommendations. I believe we go into Q&A now.
We do now. Thank you both Gabe and Kathy for this overview of the challenges, and then absolutely the resources and recommendations that are coming through. At this point, we are going to the full committee discussion. And as we did in the previous discussion, we would like to encourage and invite members of the work group that were focused on employment to join in the conversation. We would also very much like to hear questions and comments from members of the general committee. I see three people who have raised their hands. We're going to start with Sean Aliong, and James Metters will be the next person. So Sean, I'd like to turn it to you.
First of all, great report. I love the details. I talk about this a lot.
I'm sorry, Sean, can I just ask for 1 second? I just want to ask to make sure that the ASL interpreter is pinned and ready to go too, just for accessibility purposes. I'm not seeing the ASL interpreter. There we go.
Okay.
1 second. There we go. Thank you. Okay, go ahead, Sean. I'm sorry for interrupting you.
So I know that even for my personal experience, when I sign up to do a job or something, right, I get a letter in the mail saying that I might lose my benefits because I got a job. Now I am wondering when it is any federal policy that can be proposed that can stop insurance for going after those who try to make a living wage. And also, is there any way that we can hold corporations or combo federally so that they can hire those who have the disabilities? Cause I had this conversation about 2 weeks ago. More corporations need to hire people with the disabilities in the C-suite. So, like HR, human resources, so that they can hire and recruit people that have IDD. But first, I think they need to hire some disability people in HR to do the work. And I wonder if that could be a federal mandate if they want federal benefits for your corporation. So yeah, that's
Thank you. Thank you, Sean. And you've raised a couple important points. I'm going to take your last one first. You were talking about the importance of having people with disabilities and people who know disabilities actually in HR, right? And I see a note in the chat also from Kathy Kanevsky saying, "Amen, Sean." That is a comment that you were providing. And I also wanted to add your earlier comment too, and note that you were asking a question as it relates to benefits and employment. And this is something about all of these 4 work groups. There are overlaps in how some of these discussions go. And I think that question we might put until our later conversation that is specifically about federal support programs, because I think that that's going to be covered in that later discussion. But I'm wondering if somebody in the work group would like to address, the knowledge and capacity within corporations to support hiring of people with IDD.
Say that last part, the knowledge, did you say?
Yeah, the knowledge within companies to hire people with IDD.
I can, unless someone wants to jump in, I can speak from experience that it takes someone to be invested and someone to really want to have that happen. In addition to being the mom of twins with autism, I am the president of an organization who knows what this means. So we have in a organization that has 110 employees, we've committed to hiring 16 part-time folks, 16 part-time positions. That could be 8 full-time, but we budgeted for that, knowing that some of our people with intellectual disabilities cannot or don't want the full-time. So, but we have built an infrastructure internally with job coaches and programs, specialized training program leads. And that's the only way we can do this ourselves without relying on the job coaches that come in from other organizations, as we said, that have a turnover rate that just doesn't help anyone. So I think, when I can look at 3 or 4 national banks that I know are doing this really, really, really well, but it takes someone at the top to believe in the ability and the incredible contribution that people with intellectual disabilities can provide, and the ripple effects that it has throughout the entire organization. If you don't have an advocate and a champion, that's the sad state of reality, then you don't necessarily have someone to lead that. I don't know if anybody has anything different to add to that.
Thank you, Kathy. Thank you for that. I'm going to turn, we want to make sure that we hear from as many voices in this conversation as possible. So I'm going to turn to the next person who I see has their hand raised. That is James Meadors.
Could you guys hear me?
Yes, we can.
Okay. I'd like to report, but we have some major gaps in the report. I remember the last time we had our committee meeting, I shared some concerns with the committee about employment is technology, especially people with IDD who want to apply for a job, and they share different scenarios. How we could, if you want to get people work in the different businesses in the world, you have to apply online and they give you different situations. And I didn't see anything about that piece of technology because sometimes people have to do the different situations, how they would handle this situation or how to handle this situation. It's very how I could say, very I can't say the word, and that I feel like we don't talk about all the businesses. It's just bits and pieces of it. And often 9 out of 10, when we talk about hiring people with disabilities without technology, sometimes they get stuck in fast food restaurants, be it in a cleaning crew or working like a greenhouse type thing. And a lot of the jobs today, you have to apply online. And the business world is like that, technology. And I feel like it's nothing you guys say about this issue. And it's very broad for me because we need to touch all areas of employment and also all the areas of challenges, issues we face today, because the old-fashioned way you could shake the hand of the job coach talk, shake the hand of the manager of a department store or a manager of a music store. But now they have to apply online and to deal with different situations, and even the different like Office Max and Office Depot, you have to apply online. And I don't see nothing out there for people like myself who may have to get a job in the community and I have to do the different technology pieces. And I felt like that is a big part of missing in the report.
Thank you, James, for bringing up that really important point. And you know what, you're bringing up something that that we heard from Sean too, that came up in Sean's remarks as well, that this is technology. What you're raising is
it's
certainly involved in the employment part. It's actually something that has now, from my understanding of the report and how the structure is, that will be discussed as part of the community living section. And of course, employment is part of community living. So it's something to note though, that in terms of how this is described, it really is, technology is plays such an important role in employment. You're really touching on that.
I wonder, you and the community members, when I talk about employment, the electronic age, do you understand what I'm trying to say?
So that's a question for committee members. Yep.
And you too.
Yep.
I want to ask that question to the group, or do I need to explain more?
I'm seeing heads nodding. Yep. And I see in chat, I believe so. Yes. Thank you.
Okay, because we have two technology pieces we're talking about. The applying process is what I'm trying to say.
Yes, thank you. These are great points. Before we go to the hands that I see raised, I want to make acknowledge a couple comments that are coming through in chat. From Jordan Zimmerman, we have a note saying I think it's important for us to discuss how we don't just want jobs, but we want careers where we feel we can make change and belong. Thank you, Jordan, for that comment. And then also there is a note in chat from Adam Fishbein, a note to you, Sean, and to the committee about the concern about benefits and fearing losing them in your work. The Office of Disability Employment Policy within the Federal Department of Labor is doing a fair bit of work, as Adam notes, and he suggests checking out resources from the LEAD Center and the Department of Labor's Secure and Financial Futures Toolkit. Those links can be found online. So these are tremendous points that are coming forward. Now I'd like to make sure we turn back to people who have their hands raised. And the next person I see is Santa Perez. Santa, I know you're speaking and you may need to unmute on the computer.
Okay. I think that one problem is
You okay? Yeah.
that
Breathing.
the job developers and not are not trained,
I know that.
are not trained in every aspect of
Yeah, so her function was better based on technical. But
I did
was better at that time than it is now.
and
So that's why we did another echo.
they have to be trained in action. No, in and oh, and that's it. Yes.
I know.
Oh, here. Oh, and this.
Okay, and thank you, Santa. I heard there was a bit of background noise, so I heard the priority that there needs to be the job developers that are trained and in important areas. I didn't hear the last word because of the background noise. I'm not sure if that could be repeated.
So.
So we'll take a look at the actual outcome.
They are not. No, they are not active. No, ART, no, ARC, E, no, E, Archer, no, Archer, oh, train.
So training is a big issue, and I know that as we're collecting up this information, I'd love Santa and the person who is supporting us in interpretation too. If you have additional things, please make sure that gets entered into chat. And there is one more hand that is raised, but there may be a
Alex.
Yeah.
Hi, this is Jim. Can I just add a couple of thoughts?
Jim, of course.
Okay. First of all, reading the recommendations, obviously a great deal of work went into it, and congratulations to each and every member. I think job coach is a key. A successful job coach is invaluable in getting someone into the workforce. I don't know if there's a way of highlighting, making it more, I don't know, professional again, similar to the first category, personal care attendant. Maybe job coach needs to have some qualifications of training, but you get a good one. They're invaluable in getting people into the workforce. Unfortunately, it's a high turnover, salaries again, and there's really not much training involved. But on occasion, you meet somebody who's a Jim, and you say, wow, look at the success that he or she's having in placing people and keeping them in the workforce, not just placing them, but keeping them. You know, when I hear the word DEI, you know, the diversity, equity, inclusion, I always say to people, add the letter A too. A, accessibility. Very, very important to remember that. I'm not a big believer, and I'm in the business community. I'm not a big believer on the tax incentives. I don't know how much they play in hiring people with disabilities. I know a few people who have hired people with disabilities, and I would say to them, are you aware of the tax incentives that you will receive? And they said, yeah, but the paperwork is too cumbersome. I'm really not interested in that. I had an unmet need, person with disabilities, had the qualifications, and I hired him or her. So I don't know if the tax incentives are really all that of an incentive, quite frankly. The other thing is, at least in Massachusetts, and I've now noticed in other states, there are legislators saying, they're filing legislation saying, hey, any of these public projects that are going on, 1%, 2% should be set aside for people with disabilities. And all of a sudden, it's causing a lot of conversation, which I think is healthy because it brings the people with IDDD to the forefront. Hey, these people have to be included. So doing something like that might be something that you might want to consider, a percentage of public funds that should be earmarked or should be considered for people for IDDD. Just a thought.
Thank you. Thank you for contributing those. Absolutely. We are running a little short of time for this discussion. I know Liz Weintraub, you have had your hand raised for a while, so I want to make sure you have an opportunity.
Yeah, and I had to step away, so I'm not sure that this was covered. But combining this work group and the direct service, if people would like to live in the community and then how do you work? How do you pay your rent and everything like that? Other than getting money from your job. So we need I think that we need good paying jobs for people. And not 5 cents an hour, but like over minimum wage. So we need to make sure that people can get a livable wage.
Thank you, Liz. Certainly. We're just about out of time, and before I turn to you, Paul Aronson, I see you have your hand up. I'm going to reflect a couple comments that are in chat, and then I'll turn to you, Paul. There is one note from Heather Nodler related to the concerns James expressed earlier, noting that EEOC, we focus on alleviating barriers to employment through reasonable accommodation. Noting and reminding people that under the ADA, employers have a duty to provide effective accommodations to ensure employees and applicants have equal employment opportunities, including providing access to job application process through accommodations. And so job coaches are one example. So the good news is that some technology can also help provide access and opportunities if employers know how to use it well. EEOC provides training and technical assistance on the accommodation process, and the Job Accommodation Network, which is now mentioned in the report, also provides great resources for employers to learn how to provide effective accommodations. There's another comment from Kathy Konevsky about agreeing with Jim regarding tax incentives, but advocating for funding to offset the cost associated with hiring the appropriate support staff needed. Increasing salary and benefits lies isn't always important. A note from Tia that careers are important. Also, people with intellectual disabilities can have jobs like being a DD Council director, University Centers on Excellence director or co-director, and more with the right supports. We need to look at careers, not only the same ones that they keep offering to people. in higher career opportunities, not just like restaurants and the store stuff like being store greeters. So a lot of support for this conversation and a lot of energy for this. One quick note from Serena, the PCPID report writer, reflecting that that Serena intends to work with the various, well, with the work groups, the employment work group, to ensure that these concerns, particularly around employment support and support around HR, is embedded also into the comments. So with that, I'd like to turn it to you, Paul, and I think you are going to have the final word in this conversation.
Thank you so much, Alex, and I appreciate it. And I'll be real quick. I had recently raised the point of consideration with the leadership of the employment work group, and I just want to throw it out there now for the full committee and for members of the public to consider, and maybe for some future conversation. One of the issues I sort of work through here is the whole notion of vocational rehabilitation. It's got a long, important history for folks within the disability community, dating back to right after World War I, when veterans were returning, and there was an effort to sort of rehabilitate them and to help them get back into the workforce. And we know the importance of the Rehabilitation Act of 1973, and every state, I think, has a division on vocational rehabilitation services, which is basically employment services for people with disabilities. My point is, I think the term rehabilitation has outlived its usefulness. And in fact, I think it's offensive at this point because it suggests that people with disabilities are broken and need to be fixed. And it's obviously unintentional, but I think it's, I consider it the other R word, if you will. And I think we need to sort of revisit it, because I think it sort of creates a mindset, not only in people who work in sort of division of rehabilitation service sort of offices, but I think in the general public and in people with disabilities, that there's this notion that people with disabilities are less and they need to be fixed. And I just think it's something that this committee and more generally, we should all think about. I will note, as I did a little research last year on the subject, I noticed that the Department of Veterans Affairs, the U.S. Department of Veterans Affairs, has already removed that concept, I think back in 2021. So it's just something I just want to throw out there, a little food for thought as we go forward. Thanks, Alex.
Thank you, Paul. I see already a note in chat from Jordan saying, I agree, Paul. And one final word from Adam Fishbein from the Department of Labor. There is a new website that went live today related to providing employment services with transition to competitive integrated employment. Transformation Hub went live today and is available on the Department of Labor website, and I would imagine can be included as part of the resources that will ultimately be part of this report. Thank you, everyone. So with that, I would like us to move to a break. We will have another 10-minute break, and when we come back, we will be having a robust discussion of the community living work group's recommendations. Meeting. We will now be moving to the section in which we will be discussing HCBS and in the community living work groups recommendations and findings. We have quite a number of work group members who will be discussing all of the findings and recommendations. And the co-chairs, I want to acknowledge the co-chairs, James Trout and Santa Perez, for being co-chairs of this group. And with this, I would like to turn it to James, who will be introducing the members, and members will be coming forward to make your remarks. There are quite a number, there's quite a lot of content because this work group divided into additional sections. And so in the interest of time, I do want to recommend to the panelists and the presentations that you keep your remarks pretty high level so that we make sure that everyone has had an opportunity to present this rich set of recommendations, as well as allow us some time for the broader committee to have some conversation. So with that, let me turn it to you, James. James, it looks to me like you're on mute.
Thank you for pointing that out. Yes, I'm one of the co-chairs of the community living section. My other co-chair is Santa Perez. Our fellow members are as follows. We have Kelly Buckland, James Meadows, Brian Parsons, Nick Perry, Wendy Strauss, Judy Simoransky, Janine Warden, and Jordan Zimmerman. And the way we organized our section was we divided it into 4 different topical areas to address: into housing, into safety, technology supports, and finally transportation. As far as the housing department section is concerned, we found several key challenges. Firstly, a lack of cohesion and coordination persisting among Medicaid, HCBS, and housing assistance. Secondly, settings created exclusively for people with IDD or disabilities in general. We found that they do not promote true community inclusion nor independence in the larger setting of the USA. Next, specific voucher programs, we found that they support people with IDDs in order for members to have access to fair housing. That there are still domestic barriers surrounding discrimination against people with IDDs due to their income and to utilization of assets, trust funds, and savings. There is also an insufficient supply of publicly funded affordable housing in desired areas, particularly in the cities and sometimes in the suburbs of desired areas to promote truly inclusive communities. There's also a lack of awareness and planning around housing opportunities for adolescents with disabilities who are transitioning from their adolescence into adulthood, and as a result, that may well limit their vision about independent housing living options. Next, there are zoning restriction limits, again, particularly in the cities, and which limit the ability of housing options that could afford additional types of community living, such as accessory dwelling units, group homes, and accessibility multifamily construction. And finally, individuals with disabilities just in general face discrimination from landlords in violation of civil rights laws. As far as policy recommendations at the federal level, we urge that there be funding at HUD and HHS to campaign to stockholders about how rent supply increases negatively impacts people with IDD in relation to the federal subsidies they receive from housing vouchers and with Medicaid, SCBS. That the two organizations should issue a joint funding announcement for fair housing authorities to collaborate, partner with the DD and CLIL networks to help people with IDD and disabilities find roommates, affordable and accessible places to live, and well-trained direct staff care in their local communities. That Congress should appropriate funding to be co-managed by HUD and HSACL to launch a joint grant campaign that incentivizes land use and zoning reforms to facilitate the sitting and development of accessible, affordable housing, and especially increased density and near transit hubs. The U.S. Department of Education's Office of Special Education and Rehabilitation Services, OSERS, should issue guidance on incorporating information on housing, financial benefits planning, and SBHS into the transition planning and IEP processes to increase youth and family awareness of different housing and HCBS options available to individuals with IDD. Finally, we feel that Congress should increase funding for HUD to create targeted fair housing testing programs aimed at identifying patterns of discrimination against individuals with disabilities and with increasing enforcement. At the state level, we want people to participate in mainstream voucher programs and to assure the Fair Housing Authority is collaborating with the DD network and state Medicaid agency / DD agency to advertise available slots. We also want there to be a high requirement of new apartments being built to make them fully accessible and to offer tax incentives and penalties to incentivize builders to expand accessible housing development beyond the minimal federal and state requirements list. We also want to define durable accommodations and educate and incentivize agencies to support persons with disabilities and their families in solidifying housing that includes durable accommodation. Lastly, we want to pursue and encourage exclusionary zoning processes that increase the available of community living units such as accessory dwelling units, group homes, and accessible multifamily construction. Next, we have, as far as safety is concerned, we have welfare issues. The welfare is inconsistent and framing efforts to protect individuals with IDD from harm, physical and emotional abuse, or exploitation in their homes and in the community. For health issues, adults with IDD are at a higher risk of getting sick when they are required to attend congregate day settings, and we found this to be explicitly true during the highlight of the COVID epidemic. People with disabilities and people, frankly, in general, need to have more knowledge with regards to their own bodies and to advocate for themselves when they feel unsafe or like their voices are not being valued or heard. People
James,
also need.
I apologize for interrupting. I see that James Metters has his hand raised, and I think James, may you be coming to pick up the last couple pieces of this slide, James?
Yes, because that was my part of the presentation.
My apologies. I will turn my mic off.
James, before I start out, I'm going to go over the safety selection of community living. I will be talking about the challenges and then the recommendations from federal and state policy. I will be reading the exact. I will not be reading the exact what you see on the slides, but instead I will be reading the plain language version so everyone can understand. And what our group is recommended, it is almost the same as the slides, just in plain language. If you want to follow along, you can look at your email from Julia Wilburn on March 18th. Like we addressed like 5 challenging things in what James said. And I know James did a good job to explain what these are. If you want me to jump in where James stopped, I could, or keep on going. It's up to you guys. Okay. Okay, I'm going to talk about the federal policy recommendations to promote safety and individuals with IDD. The number one is strengthen federal regs investments in the National Adult Protective Services, APS, structure to assure quicker and more successful actions of complaints, investigations, and oversights. Number two, the U.S. Department of Health and Human Services could conduct a study, include reaching out of partners like DD Councils, USES, Protection and Advocacy, and SILKS. Lessons learned from the COVID-19 virus as it relates the provisions of home and community-based services, specific to individuals with IDD, included describe what worked well, the barriers they were difficult to overcome, and steps can be proactive and difficult to overcome, and the steps that could be I have a hard time saying proactive taken by communities and states to protect the individuals with IDD, the event of another public health emergency. Number three, go ahead.
Thank you, James, for picking up right there. And I want to make sure if we can ask Census to go back one slide. I jumped in there because I wanted to make sure, James Metters, that you were able to pick this up. Number 4 and number 5, we didn't talk about those. So if you could cover those, and then we can skip to the next couple slides.
Sure. I don't know where James started. He stopped at 2 or 3.
He stopped after 3.
I did the first 3.
Yep.
Okay. I'm sorry. Environment safety. People need more knowledge about protocols in their homes and natural surroundings, and how to take care of themselves. Number 5 is emergency planning and crisis response. The lack of understanding of knowledge, coordination, commitment around durable accommodations, and also the lack of accessible shelters, temporary housing, and impact on disability benefits when you transfer across one state due to an emergency.
Thank you, James. So now that we've really called out all of those challenges, you've touched on the first 2 federal policy recommendations, welfare and health. And then you can move to the third one.
Yes. Personal safety both in school and via Medicaid HCBS. Programs require access for individuals with IDD to health education, and made for individuals with IDD learn about their bodies and body functions parts and privacy, learning how to say no, to know what is appropriate, and being able to tell someone without any retaliation or judgment. And that this required be incorporated annual individual's education plan, IEP, or the annual HCBS with person-centered service plans. Environment safety. Amid a public readiness and emergency act, PREP Act, or further regs issued by the U.S. Department of Health and Human Services to ensure that home and community-based providers and the federal funding consumer-led organizations like the DD Councils, SILKS, for example, are required partners in state and local emergency planning. Also require all disaster preparedness and education are kept cognitive accessible with instructions and or materials written in plain language. Finally, we define durable housing and success services coordination refer process to ensure that individuals with IDD and their families have the access that the information and are connected to, and the resources they need across the system. State recommendations to promote safety of individuals with IDD included HCBS providers and state program representatives on state and local emergency planning advisors committee. Offer services within HCBS waiver program, so there are long-term reimbursements, pathways for access for advocacy training in personal safety and self-determination. Then the partners with consumer-led organizations like a self-advocacy group and a Center for Independent Living to provide such service. Engage stronger state-level investments in adult protective services. Hire more staff. Offer more training in abuse and assault areas. We need to gather more evidence by listening to witnesses, family members, or the person assaulted. Train staff to notice when behaviors are different than usual of everyday behaviors. As this often shows something unusual is happening, review or do a study how APS is doing their job in each state. And that's the end of the report.
Thank you, James. Now we'll be turning to Jordan.
Hello, I'm Jordan. First, thanks to the working group chairs, Santa and James, for leading us. Within our community living working group, we identified a few key barriers, or challenges, to technology supports, which I'll begin with. To start, there is a general lack of access, which is really fragmented across local communities and states. Access should be, and absolutely is, a fundamental right, but gaining this access to assistive and accessible technology can be a really disorganized process, which leads to major barriers in people with IDD effectively communicating and engaging in community, and leads to prejudice, discrimination, and dehumanization. This is hard because people need to learn how to use assistive and accessible technology as early as possible. However, this often isn't happening in early childhood programs and schools. Even when people with IDD do receive access, it can be difficult to maintain that access or keep up with the newest software, so federal and state funding is needed across the lifespan for upgrades and newer devices. Our work group also identified that a lot of public materials are not available in plain language, and broadband access is still really inconsistent in many areas. Next slide, please. We have a few federal policy recommendations. First, we suggest that the Department of Education update guidance to urge local education authorities to include assistive and accessible technology needed for students with IDD. Next, the Center for Medicare and Medicaid should provide guidance on the importance of establishing replacement, recycling, and refurbishment programs to enable access to upgrades and newer devices. We also discussed increasing the Department of Health and Human Services and the Department of Justice's enforcement resources, staff, and activities to promote accessible and inclusive community living options. And last from this section, the Department of Health and Human Services should issue additional set regulatory guidance to ensure all communications are available in plain language. The work at the federal level is really important, and we also have some incredibly important recommendations at the state level in this area. The first is to require local education authorities to include students' preferred, assistive and accessible technology in their individual education programs. Next, initiate gubernatorial technology first initiatives to promote cross-systems prioritization of public resources to support technologies that assist and enable people with IDD to thrive in education, employment, housing, and community living. We also discussed state partnerships to support replacement, recycling and refurbishment of durable medical equipment and assistive technology for individuals with disabilities. And last on this slide, we recommend a requirement for all entities or recipients of federal funding to afford AAC as an auxiliary aid or service if doing so does not result in a fundamental alteration or undue financial and administrative burden. Next slide, please. On this slide, we have intermediate and long-term recommendations for ensuring the fair and equitable use of AAC methods, tools, and supports. First, the Department of Education and Department of Health and Human Services should prohibit recipients of federal funding from administering IQ assessments or similar tests on people who need or might benefit from AAC and don't have access. We know, and have tons of people sharing experiences, IQ tests only lead to delayed or completely denied access. Next, the Center for Medicare and Medicaid should issue clear guidance on the mandatory early screening benefit and durable medical requirements, assuring access to effective AAC that is fair and equitable regardless of race, disability, language, or other protected class status. The Department of Education should also ensure that the new $50 million grant program to enhance critical school-based mental health services to students who experience bullying and trauma is implemented in a way that increases access to AAC and also increases understanding of trauma when access is denied or delayed for any period of time. Lastly, the Federal Communications Commission should explore ways to fund the purchase of augmentative devices to access the Internet, video conferencing platforms, and other expressive purposes. Thank you.
Thank you, Jordan. And this last section, we'll turn to Kelly Buckland.
Yeah, thank you. Hi, I am Kelly, the disability advisor at the U.S. Department of Transportation with Secretary Buttigieg. And I'm going to be presenting the transportation recommendations and challenges. So all transit must be accessible, especially in rural communities where there is less transit available. Today, there are still major gaps in available accessible transportation options for people with disabilities. There are also very few supports to teach people with IDD how to successfully navigate public available transit options. And lastly, Medicaid HCBS rates for non-emergency medical transportation are often very limiting in terms of market value and restrictive in terms of use. Next slide, please. So before I came to the Department of Transportation, I knew transportation provided a very important service to people with disabilities, in fact, a critical service. But since being there for about 2.5 years, now I know even more about how much it really needs to be in place for people with disabilities to thrive in all the areas that we've already been talking about. So our policy recommendations are: one, that the U.S. Department of Transportation should issue joint guidance with the U.S. Department of Health and Human Services and the U.S. Department of Justice, reaffirming that all publicly funded transit systems must be accessible. Guidance should include examples of promoting practice or promising practices of local and state transportation models that demonstrate how they are inclusive and prioritize people with disabilities. And there are some really good examples out there. With authorized funding from Congress, the U.S. Department of Transportation should invest in innovative grants to support infrastructure development and capacity building to expand on-demand and flexible response transportation models so that individuals with disabilities can access transportation in real time when they need it. A little bit of personal privilege here. The department actually will be very soon, maybe within the next month or so, be issuing a notice of proposed rulemaking that will ask people about paratransit and how paratransit should be changed and may provide more on-demand kind of responsive systems. Number 3, revise CMS guidance on non-emergency medical transportation to offer more expansive options for states to fund NEMT and transportation education for individuals with disabilities, and specifically individuals with IDD. Next slide, please. Transportation proposed state policy recommendations are: 1, require drivers of public transportation systems to complete sensitivity training for different types of disabilities. This includes physical, intellectual, and social disabilities. Number 2, exercise existing strategies and flexibilities outlined in recent CMS guidance to assure expanded access to non-emergency transportation supports and prioritize the inclusion of innovative transportation support strategies within new 1115 applications as it pertains to creating more expanded, inclusive transportation options, specifically for people with IDD. Number 3, invest in training for individuals with ID as part of their transition education in schools, and also as part of available waiver services under HCBS to learn how to successfully utilize public transportation options. And number 4, invest and incentivize the expansion of on-demand and flexible response transportation models so that individuals with disabilities can better leverage local transportation options to live, work, and thrive in typical communities. Next slide. I thought that was the last one. So back to you, Alex.
Thank you, Kelly, and thank you to all of those members of this work group who have presented both the challenges and the recommendations to date. Now we are in the full committee discussion part, and as a reminder, this group, the community living group, has covered a lot of territory, including housing, safety, technology supports, and transportation. So I would like to invite members of the work group, if they have additional comments or commentary or perspective to provide, to certainly raise your hand and chime in, as well as for the full committee who may have questions or comments that they would like to offer. I see 2 hands are raised currently, and again, we can also take questions or comments in chat. The first hand that I see up is Sean Elion. Go ahead, Sean.
Wow. First of all, that was a great major report. Good job, everyone. I want to know, because of the housing crisis, it is any way that we can try to increase on funding for housing to make housing more accessible, because I live in the city, right? I'm from Philadelphia. I see all these new construction, these new constructions going up. Plus I'm a real estate miner. All these luxury apartments being built. I wonder, is there any way that we can propose? And I know it probably something out there, but if we can propose a voucher that can set aside a certain amount of these high rises, that can be set aside and be converted into units for those that have IDD and significant disability. My second question is, how can we shorten the waiting list? And my last point is, the CCT. Well, I'm going to be honest. Huh? Paying insurance rate, I don't take it, but for those who I know that take pair insurance, it's not set up right. They be late. Sometimes I hear that the driver have a attitude and all this, so I wonder if it's some type of federal training that every pair with transit have to go through. Thank you.
Thank you, Sean. I heard 3 questions that your comments that you provided, and maybe we can pick up on one of them. You first asked about affordable housing and whether there are voucher options, and maybe somebody in the work group could provide a reflect back from some of the recommendations that there are. You also asked
No, not. I know that there's vouchers out there, but I wonder if somehow that we can make it like law, like when a developer start to build these high rises, that they set aside a certain amount to be built for those that have significant disabilities, so that they can live in a community setting, like for a example, there's a 2 million or more building going up down in Center City. And those things go for a lot of money. I'm pretty sure that somehow they can set aside some of the units for those that have significant disability so that they can have a good quality of life as well.
Got it. So affordable
Yeah.
and accessible housing in new settings. Santa, I see that you wanted to jump.
So we were talking about having the developers have more housing. Section 5? No, more housing. Subside for people. Subside for people. Subside for people with disabilities. If there are 16, no. 6, no. Accessible, no. In, no. If they are making houses, we will have more a percentage houses that are already accessible.
Thank you, Santa. So underscoring the importance of having more and a required percent of houses be accessible and affordable to people with disabilities.
Yes.
Thank you. Thank you for that remark. And that certainly picked up from what Sean was talking about his question. I would like to turn to one comment that was in chat. This came from Joe Macbeth, and that Joe's comment is, thank you for this great report out. In regard to safety, the intellectual and developmental disability sector does not invest in paid peer support. In other sectors, peer support is a major focus. Can we connect peer support with training on safety? This is an idea that Joe is putting forward. Are there members of the work group or of the committee who would be interested in responding back to that question?
I could respond that.
Go ahead, James.
For myself, one that I put my other hat real quick first. One of my jobs in Texas, I do a lot of peer support for people with IDD. And we talk about community safety, the issues of Joe is stressing. And I know I'm not the chair of the committee or the co-chair of the committee, but I feel it would be appropriate. But I know I'm just one person. With that, I think peer support is important, but at the same time, I want to talk about community safety with that. And I know I'm not chair or the co-chair of the committee, but that's my 2 cents.
Right. There are two different ways to talk about disability. Safety. The first one is personal housing. No, personal housing. how to be safe and ongoing, no,
This will, oh, sorry, I thought you finished. This is one of the things I shared with the committee, the work group, because that is one of the things I'm really firm believer about community safety, and I was pretty vocal about this issue because as a person without who is a sexual assault survivor, and that's why I was very passionate what I was saying to the group today about this issue, because it's important to have our input and share all types of community living situations, no matter if you're having your own apartment, but at the same time, you need to feel safe and to have the peer support if someone harm you, or to find someone you could feel safe to talk to about this issue. I don't mean to step over people's boundaries of sharing the care.
And the other way, the other thought is about being safe, no, to be safe from, no, in, out, no, in, this, in, oh, in, to be, wait, paraphrase, to be in disaster preparation. Have more people be involved in the population. No, yes, no, no, in the oh, in, well, that's what happened to AT. In the preparation.
So thank you, Santa, for your first and second comment. Your first being about personal safety, and then what I heard you say also is being safe from harm in disasters or in preparation for disasters. And I think this does tie back to, it sounds like it ties back to even the potential for peer support, because the more people that are involved and connected certainly can be supporting both on a personal and then in a long-term planning for disasters, emergency preparedness kind of approach. Yeah. Does that hit on your point, Santa?
Yes.
Thank you. Liz, with Liz Weintraub, I see that you have your hand raised.
Yes, thank you. Two comments. One about plain language, because I feel very strongly that it's for people with intellectual disability need to be part of plain language and learning and being part of that process. I have seen so many times where people just say, well, I think this is what plain language is and whatever, and they sometimes don't include us in that process. So that's just a reminder for everyone. And then about I think the housing issue goes back to the job issue and in some ways go back to the DSP issue, because if we want to live in the community and have housing in the community, it costs money to live in the community. So therefore we need jobs, and to live in the community, we need our DSPs. So it's sort of like a circle. And I know we have talked about that when we first talked about this report, probably 18-19 months ago, but I just wanted to say that. So thank you.
Thank you, Liz, and thanks for reflecting on that really important point too, that all of these things are connected too. There are a number of comments that are coming through in chat, and I'm going to read a number of them, and then we'll have an opportunity to respond. First was a question from Adam Fishbein, when we were talking about housing, and a question just saying, isn't it already the law that new housing be accessible? I'll give members a minute to think about that and respond to. There's some appreciation for you, James Metters, for your comments and remarks, really making sure that that I'm reflecting thank you, and also a comment from Glenna Wright that in addition to safety, we all need human connections, and there's certainly follow-up on that. There's a comment from Tia Nellis. Great job from this group. I feel that in order for this all to work, everything that is mentioned from all the groups about HCBS needs to be enforced and all the laws in place. If we want people with disabilities to have a great life, and there needs, if we want that, and there needs to be, it needs to be monitored also by people with disabilities. And if they don't follow, there needs to be consequences. Thank you, Tia. A follow-up from Jordan too, yes, about human connections, which requires access to the community, communication, and all that we're discussing today. And then a follow-up comment from Serena Lowe, that the point that, back to you, Liz, this being such an important point, to assure we're producing committee materials and a report that includes plain language. Noting that Nicole LeBlanc, who is a self-advocate with lived expertise, has been subcontracted with Serena and has been supporting the transferring of all materials for this report to plain language versions. We want to acknowledge and appreciate Nicole's amazing efforts and hard work. And this is a reflection from Serena. Apologies for the oversight up until now, Nicole, but really a great appreciation for you, for your contributions to where we are today too. So I want to go back to one quick, if I'm going to let folks, they've got their hands up. Let me turn to you, James Metters.
Yes. We do have peer support, but it's pockets of states who are doing it. And we need to find another, because one of my jobs in Texas, I've been doing a lot of peer support, teaching advocates to be involved more into like different committees and boards to share input, but also to be out there to reach situations and stuff. But I also want to answer Tia's question also, is that when we put that report together, we will look across the board about these issues, is because when we address these issues, we're using different states in different situations of problems like accountability, like APS. We have something about APS, and we want to really, really point out what things are broken. And at the same time, we want to address what is broken, and at the same time, we try to fix it and stuff. We're using real life situations, what we notice right now in the current situation in individual states and also the country, of how we could break down that stigma of, I use APS, for example, because we felt like it's broken. We need to somehow to fix it, to be more accountable, to help people who are in danger or been hurt by sexual assault and also been hurt by abuse and stuff. And we need to do a better way to help folks to feel safe to talk about it and get results what they needed.
Thank you. Thank you, James. I see Kelly Buckland, you have your hand up.
Yeah, I just was gonna address the question from Adam. It is federal requirement that housing be accessible. 2% needs to be accessible to people with visual disabilities or hearing disabilities. And 5% needs to be fully accessible to any new apartment buildings. I think what Sean was trying to get at was that it's not affordable. So really tying new vouchers or new housing to vouchers so that it's not only accessible, but it's affordable.
We want more housing than 5%.
Thank you, Kelly and Santa. Yeah, so certainly affordability, and as Santa was saying, making sure that there's the housing stock more is available as well. Tia, I see you have your hand up.
Yes, my point was to go back to what James was saying. My point is that we need to implement all these things and not just have it on paper that looks nice. We need to make sure that all these things are put into law that we have discussed, and all these things are really important for people to be able to be a part of their community and to have a good life and good jobs, just like everybody else in the world. So I think that my point is that everybody in this groups have done great jobs, and hopefully by reinforcing all this, we need to keep on using our advocacy voice so that it's just not nice words on paper.
Hear, hear, Tia. Thank you for that important comment and for underlining what you would put in chat. That's really great. And I encourage, if people have put things into chat and they'd like to add to it, please do put your hand up and chime in. Janine, I see you have your hand up.
I do. So I'm from the Department of Housing and Urban Development, and I wanted to talk a little bit about some of the wonderful comments I have heard about housing. So obviously there is a housing shortage, and particularly an affordable housing shortage across the country. But when you're talking about accessible housing or housing that comes with services, most of that is housing built with money from the federal government. Private housing has some accessibility, but it might not work for everyone. And so some of the advocacy that may be needed from some of the people in this group who are so talented at advocacy relates to maybe providing a higher level of accessibility in private housing and in housing that comes from money from the federal government, a lot more accessible housing. Thank you.
Janine Warden, thank you. Thank you for that comment and for that reflection as well. I saw that Santa Perez had her hand up and now maybe does not have any more comments. I see another comment here from James Trout. This is following up on the housing discussion, saying we have to deal with grandfather clauses in housing policy. I'm wondering, James, if you would like to expand on that?
When the ADA was passed into law back into 1990, for example, there was a huge discussion over whether or not to include housing as part of the policy, because of genuine concerns that there would be a lot of dissenting votes from that, and concern that they weren't going to get bipartisan consensus. That portion was that the requirement that housing be fully included in the ADA was completely dropped, and this is particular and as a result, a lot of older buildings are often exempt from having to become accessible. I mean, as my accent indicates, I come from New England, and there are a lot of, for example, and particularly in my hometown of Boston, there are a lot of triple-decker buildings that were three-decker buildings, three-floor apartment buildings, for example, where you have one apartment stacked over another three stories high, and a lot of those buildings were built in the second half of the 19th century, early half of the 20th century. And they could not be built today because of stricter regulations, but they would not. But those would have. Those wouldn't be able to be modified for people with disabilities, for example. And there are similar examples like row houses in other cities of the country that are not accessible. So again, that's what I'm referring to.
Thank you, James. So referring to the older housing stock that absolutely is in many cases not accessible, indeed. We're at the place where I don't see any more hands up, and the comments in chat have slowed down, and at this point it looks that the committee members are wrapping up this portion of the conversation, and so I would suggest that we move to take, as we have done, a short break. It will again be a 10-minute break we will be taking, and when we come back, we will be moving to the final section of final work groups discussion, which will be focused on federal support programs. So 10 minutes, please, and then the group will be reconvening. Thank you. Everybody. Greetings, everybody. We are coming back from a break and moving into the final section of today's PCPID committee meeting. The section we are about to move into is focused on federal support programs. And to take us through this section, we will be led by Paul Aronson and Sean Eliong, the committee co-chairs, and with input from committee members. We will follow the same approach where we have challenges and federal and state policy recommendations and a group discussion with the entire committee. With that, I'd like to turn it over to Paul.
Great. Thank you so much, Alex, and good afternoon, everybody. It's great to be here. I want to thank our chairman, Jim Brett, all of our colleagues throughout the committee, and of course, our colleagues in the ACI. We are the last one to present today, but certainly not the least. And we're going to be talking about federal support programs. But before we do, I just want to sort of step back and say how personally and professionally excited I am to be a part of this initiative, to be on this committee, and to be focused on home and community-based services. I think our decision to sort of focus on these important issues are absolutely critical, because as we all know, that home and community-based services are vital, absolutely vital to folks with disabilities living safe, fulfilling lives in the community. And so it's great to be part of this conversation. And it was great to hear our colleagues today talk some of the key components of HCBS about the importance of a strong workforce, the importance of a well-paid, well-trained, and well-respected workforce, the importance of meaningful employment opportunities, the importance of housing, safety, technology, and transportation. And so we're going to take the conversation now to a more basic level, to those federal support programs that are absolutely vital to folks living in the community. And we're going to be focusing on the three programs that we think are most important to people with intellectual disabilities, and that is supplemental security income, Medicare, and Medicaid. And in fact, Medicaid, as we all know, is critically important because HCBS is based in Medicaid. And so it's imperative for us to make sure we get this right. We need these programs to not only be meaningful now, but sustainable going forward. Before we do that, I just want to sort of acknowledge our work group members, my co-chair, Sean, who he and I have worked very closely together over the last 18 months. But also the members of the committee, our fellow citizen member, Paul Boskin, and our federal partners who have been a tremendous resource for us, not only sharing their ideas about where we should go in our conversation, but very importantly, about, being a resource for us and helping guide our conversations. So thank you for that. And it's been a real collaborative effort. And I hope everybody agrees. And with our presentation today, that where we've come to, sort of where we've ended up is really reflects the input that we've been sharing over the last several months.
There's something wrong with your camera.
Oh.
I was just about to jump in. It looks like you've got some technical issue going on. We're seeing a screen, but a white screen. We're not seeing your video feed coming through. It was fine, but then it has changed.
It's been fine all day. I wonder if is there something on the back end? Because I don't.
I'll ask the census team to perhaps unpin Paul, and then maybe you can try turning your video camera back on. It may be that we just go ahead with Paul. We hear you just great, and we can continue along that way too.
I'll continue then. So looking at the key challenges, the first set of challenges we look at relate to Social Security and Medicaid, and those are the income and asset limits that exist. Challenges here are that those income and asset limits really don't reflect the economic reality faced by people with disabilities. As we know, Social Security, supplemental security income is a federal program. And right now, I think the income limit is about $945 a month. The asset limit is $2,000. And that asset limit, by the way, has not been changed, as my understanding, since the 1980s. So clearly in need of some reform there. In terms of Medicaid, it's a federal state program, and so it varies by state in terms of income and asset limits. But in my state, the great state of New Jersey, the income level right now is $1,255 a month. The asset limit is $4,000. Again, those numbers don't necessarily reflect the economic reality that a lot of folks with intellectual disabilities face. And so that's a challenge. The second challenge is what we call the sort of the notorious marriage penalty. And by that, what we mean is embedded in a lot of these programs, and not just these programs we're talking about, this is a lot of federal and state and local programs, but is embedded is a marriage penalty that basically precludes folks with disabilities from getting married, which is absolutely horrible, which raises a whole civil rights and human rights issue. And just to give you an example, supplemental security income, the asset limit is $2,000 for an individual. For a couple, it's $3,000. And so it's not even double. And so again, there's not only a disincentive for folks to get married, it actually, there's a barrier because there's a real risk of losing much needed programs and supports. The third challenge has to do with Social Security, supplemental security income, and those living in state licensed residences like group homes or supervised apartments. Here, the issue is that provider agencies are able to take up to 100% of an individual's SSI to cover rent, to cover food, utilities. And not only is there no limit on how much they can take, doesn't seem to be any real requirement that they itemize that they explain where that money is going. And so that poses a real challenge for folks. And then fourth, with respect to Medicare, there's a 24-month waiting period right now for folks to get Medicare who are moving on to Social Security disability income. And this becomes a challenge for the individual who might be on their parents, on their family's private insurance. The parent either retires or passes away, putting that individual now on SSDI, transferring them to Medicare, except there's a 2-year gap between the coverage of the private insurance and Medicare. And so that's something that poses, as you can imagine, a real challenge for some folks. So moving to our policy recommendations. And I'm just gonna see if I can fix my camera. I just noticed that too. I don't know but I'll just finish up, Sean, and then I'm just going to pass it on to Sean, and Sean's going to sort of elaborate on all these points and sort of put it in some context that we can all understand it a little better. But in terms of our federal policy recommendations, again, it's very much aligned with the challenges, increasing the SSI asset and income limit. Again, there have been some proposals that have been floating around Congress for several years. We really need to address this, making it, again, more realistic, more aligned with, economic realities for folks. Second, eliminating the marriage penalty. Just fix it, what I mean? So whatever the income limit is, double it for a couple. Same thing with the asset limit for an individual, double it for a couple. Third, limit the access that providers have to a person's supplemental security income, and not just put a limit on it, but also, increase the transparency, making it so, they have to actually itemize how that money is being spent. Seems like a reasonable ask, and should be a reasonable requirement. And fourth, eliminate the Medicare care waiting period we talked about. Again, I don't know why that's in the law. I don't know if it was unintentional, but that 24-month waiting period can really be a serious issue, for a serious challenge for an individual who had relied on private insurance and now is sort of left on their own for 2 years. In terms of state policy recommendations, our next slide. All right, all relate to Medicaid. Again, because Medicaid is both a federal and state program. States, there are federal guidelines, federal rules, but states have some flexibility in how they implement it. So again, first one, increase the asset and income limits, and they should be aligned with where we end up with supplemental security income at a minimum. 2, elimination of the marriage penalty once and for all. 3, elimination of age and income limits on state Medicaid buy-in programs. Now, these are programs, really important programs, and this goes back to something that Sean had raised in an earlier context when we were talking about employment. These are programs that allow individuals to sort of meet, their professional aspirations, if you will, and sort of allow folks to make larger incomes, but not lose very important, very vital Medicaid supports. I know in New Jersey, we used to have an age limit of age 64 and an income limit of about $70,000. 2 years ago, our governor signed into law legislation that eliminated that age limit and eliminated the income limit. So now individuals can work as long as they want and make as much as they want and not lose vital Medicaid supports. And then fourth has to do with Medicaid portability. An individual, and we look at this in 2 ways. One is, an individual moving from one state to the other shouldn't have to sort of go through the whole Medicaid eligibility process again. And second, person who has Medicaid in one state should be able to utilize Medicaid providers in border, sort of neighboring states. I can tell you again, here in New Jersey, we have New York City, we have Philadelphia, great doctors in both, and we have our own great doctors, but there's some that folks need specialists in those cities. They should have access to it. Their Medicaid, there should be a requirement that their managed care organizations cover those providers too. So that's it in a nutshell. I'm going to turn it over to my friend Sean here, who's going to sort of add some color to this and sort of talk through these issues. I'm going to try to fix my camera in the meantime. Thank you.
Paul, do you control the size, or the census control the size?
I think census, our colleagues at census are doing the slides.
Yes. So
Which slide would you like, Sean? I can go to whichever one you need.
Can you just scroll all the way back up to the top? Thank you.
Absolutely. This one?
Yeah, all the way up. So down. So like Paul say, I'm Sean Leon. I'm on the Social Security benefits committee, and I made the federal support committee. So right now I am going to talk about how we had to look at this issues as human rights and civil rights issues, because there's one thing to have laws, but there's a other thing to not have the appropriate policies and place. Like for a example, like the Social Security resources are too low. Like they had not been raised for years. Like in this boom, in this economy, we is proposing that they raise the minimum and not just to the minimum wage, but so that they can have a living wage, right? So that they can be successful in life, right? Because Paul, when was the last time that the Social Security limits were raised?
I think the asset, so the income limits get increased every year, not necessarily enough. But the asset limits, I understand, have not been raised since the mid-1980s.
Yes. So we have a problem here. We have a human right problem because the asset limit had not been raised in about since the 1980s. That's a major problem. And a other thing that I want to focus on is that getting married because you have a disability should not be should not be punished. It should not be punished. It should be allowed. So we is asking to eliminate the marginal penalty policy, because this is a democracy. Why are we punishing people because they love who they want to marry, but because of their disability, they will want to limit access to their income. We need to dismantle this 24 months period, because this is a democracy issue. No one should not wait this long to collect Social Security. This is a vital resource to someone that have IDD and all the disabilities. So it seems to me that these issues are real important, because one, people with IDD deserve the same support, the same respect, the same rights to live in the community, to get married, to have a job, and to collect Social Security disability income when they need it. So that is my report.
Thank you, Sean. And thank you for.
And I'm so sorry, Alex. I just have this one more thing. We need to think, if we're going to build an inclusive nation, then we need these support to be part of our democracy.
Sean, your microphone is, it's a little hard to hear right now. I think it might be because of you're leaning forward. If you sit back a bit, I think we can hear you better.
Yes. We need to think of these supports as fundamental rights that help all people with disabilities live in this nation that we say that we have democracy. These benefits is independence. These benefits is equal access. If we don't make this a priority for those that have IDD, we are cutting equal access for all based on just their disability, and that's not right.
Thank you. Thank you, Sean. And you've hit on and really underlined a lot of really important issues coming away from some of these key challenges and moving to the rights that people have. I think that Paul and Sean, I believe you have now made it through the formal part of your recommendations. And we are moving to the place where we will have the full committee discussion. And this is again an opportunity for the entire committee. Anybody on the committee is welcome to raise their hand or put something into chat to reflect on these particular, in this particular topic area related to the federal support programs. James Metters, I see that you've had your hand up for a while, so I'll turn it to you, James.
I have two questions, but I'll make it brief and quick. Did you guys talk about the Able account? Do you guys know what I'm talking about?
Yes.
James, hey James, Paul. Yeah, we did, and I believe it's going to be in. I'll turn to Serena. I think it's going to be addressed in the report.
Yes.
Yeah.
Okay, I'm just asking because when I look at it, I didn't see it. That's why I'm asking. The second part of that question is Social Security and SSDI. I think this question is more appropriate here than the housing question. Because, for example, I get SSDI, and the place I'm living is not a HUD program or a voucher program, but it's a subsidy program. I have to renew my lease each year. But each year, when we get a cost of living adjustment from Social Security, it would cost more money to increase my rent to substitute the gap what they're asked for rent, because each year they increase the rent because I don't pay full price for where I'm living. I pay half the cost, the market price, and the cost of living. Each time we increase a living expense, it's going to take some of the people who get income raised up from Social Security, SSI, or SSDI. And I wonder if you guys talk about the different subsidy programs of cost of living adjustments, because the department is take that money to substitute the money they would lose if they don't do that.
Do you know what you bring up a real important, a very important point, and I always wonder why can they just not just set a rate, a permanent rate for a housing, like if they know they're going to subsidize that that particular condo unit house, why can it just be the same weight as for years and years and years? Why do we had to go through this channel, or we had to adjust the weight to this particular this year, and then if it go up, then we had to figure out, like, why don't they just have just a set weight for each symbol? It's 850 this year. As long as you live here, it will be 850. Like, that will be ideal.
Because
but we live in a capitalist society, and it don't always work that way, unfortunately. That I do realize.
You've hit on that for sure, Sean. And I see, Paul, that you're back on video. So maybe the census team could spotlight you. And let's see, I've got a couple more folks in the queue. I see Jim Brett, you raised your hand.
Yes, Paul, a great report, a lot of hard work. Obviously, you've done some research on why, since the 1980s, we haven't increased the asset income. We haven't done the marriage penalty. There's got to be an impediment. There's got to be a roadblock. There's got to be something preventing this from happening, because it's common sense. It's long overdue, but there's got to be something going on saying we're not doing it. And I don't know if it's revenue, it's changing some regulation, but there's got to be something, because it just makes too much sense.
Jim, I've been saying this for years and years. Something not adding up. So we had to figure out how we could get them to change policies or something.
I'm sure if you walk down the halls of Congress and you buttonhole any one member and say, would you be in favor of increasing the asset income from two? Oh, sure. Are you in favor of, eliminating the marriage? Oh, sure. But there's got to be a reason why, since the 1980s, over 45 years, I just can't figure it out. Maybe you have, Paul.
I haven't figured it out, but I appreciate the question, and it's an excellent point. And, I've got to believe, and we see this not on just these issues, we see it on a lot of issues, that there are some common sense, changes that are needed. I think and again, I'm generalizing here, but I think it's just the issues that affect our folks, our community, aren't a priority often enough. And I think, you're right, because I think you won't find anybody who will disagree, because it makes perfect sense. And, folks, regardless of their political affiliation, regardless of their place in government, they want to do right. They want to do the right thing for folks with disabilities. Except I think the problem is when you're changing policies, and I see this here in New Jersey, it takes a lot, and the legislator needs to stay with it and needs to drive the conversation and keep driving the conversation. And they've got a lot of competing issues coming at them. And I think our issues just sort of fall off the plate at some point. But I can't imagine anyone would disagree with what we want to do here. Yeah, I agree.
Paul and Jim, how do you think we can force them to do that? Because we try to ask them. Now I think we need to apply some pressure.
Well, I mean, this report goes to the president. It doesn't really go to Congress. There's something maybe after the report is published that you bring it to the members of Congress or your senators, and ask them to not only support it but advocate. As Paul says, everyone is in favor of it, but no one seems to want to push it as a priority, and that's what needs to be done. So that's going to be a little mini course after we've published the report on advocacy, and we should work on that maybe later. But I just wanted to add one other thing. That ABLE Act, the American, Another Better Living, that came from, believe it or not, PCPID, 2007-2008 report. It was called the Long-Term Disability Savings Account. And then in 2014, it becomes a law. So PCPID should take a lot of credit on it.
Thank you, Jim. I see Liz Weintraub, you have had your hand up for a while. Would you have a comment?
Yeah. And I apologize for always talking, but I do have a question. And I don't understand this, but are we as people with disability the the ones who are discriminated against, because excuse me, because it seems like people who are poor or who might not be able to get enough money to do things. Is it just people with disability? And I worry about all means all. That's one of my favorite saying, all means all. Do you understand what I'm trying to say? Because this is sort of great to me.
Yeah, thank you, Liz. I appreciate that, and I agree with you. All is all, and it's a great saying. I think, there are a lot of communities that sort of face, if it's discrimination or however we want to term it, just a lack of justice, if you will. And I think what our community, and I've seen this locally and nationally, it requires a sustained sort of advocacy effort, and there are sometimes challenges for our community in terms of keeping up the advocacy. And I think, legislators, members of Congress, they've got a lot of issues coming at them. And so that's why a lot of groups sort of mobilize and have these sustained efforts. And that's what we need to do. Again, I can tell you this from my day job in New Jersey as the state's ombudsman, I don't find anybody disagreeing with wanting to do the right thing by the folks with disabilities. Republican, Democrat, otherwise, everybody wants to do the right thing. It's just, it's making it a priority and sort of, keeping our voices loud. And I think, this report gives us that opportunity, not just to get on this federal supports program piece, but on all the issues we've discussed today. And again, as Jim pointed out, this committee does have, can have some weight, I mean, when we look at the ABLE accounts as a good example of something that came, but it takes time, unfortunately.
Thank you.
Thank you.
Thank you, Liz, for that question, and Paul. Kathy Kanevsky, I see you have your hand up.
Yep, Liz, you're not the only one that talks all the time. I find myself doing that too. I have a question about the asset limitation. So silly me, I don't know that I ever realized that it was by state. So in Delaware, it's 2,000 and it's not changed. I can't imagine for years and years either. But I'm curious as to what that range looks like throughout the country. Does anyone have kind of a handle on what the lowest amount is and what the highest state is? And what's the reason for that, the
Sure.
range? And then how do we handle advocating?
Sure. Thanks for the question, Kathy. So just to clarify again, so with supplemental security income, it's a federal program. And I think the income and asset limits are the same across. So 2,000, 3,000 are the asset limits across. Medicaid,
okay.
Medicaid varies. And I do have the list. I don't have it with me right now, and I could share, get it for the committee, the range of, of both income and asset limits by state and Medicaid.
Okay, thank you. And then as far as ABLE goes, I know we've been trying, and I say we've been trying, and I guess if this is happening other places, we're not trying hard enough. I probably just need to pick up the phone. But to actually offer a match for an ABLE account, just like you would for a 401k as an employer, I've heard of a couple. I think Easter Seals nationally does that. Does anybody know of any other? Is that a common practice? I guess is the way to ask the question.
I don't know. I don't know if anybody else knows.
Because that to me would be an ultimate sign of fairness, right? I mean, if you're hiring someone with a disability and they can't have a 401k.
That's why I say that we need to somehow change the policies and hire someone in HR that have a disability so that they can help figure that out. Because then to me that's not cool. Like you can apply for a 401k?
I will say, my understanding is I've been working with a family here in New Jersey recently, that 401ks are sometimes considered assets by Medicaid, depending on the states.
Yes,
Yeah, and so that can,
that's my point. Thank you, Paul.
yeah, and it's not every state that does it, I think.
Oh.
Yeah, so I've just started to look into that just because I've been working with a family on it, but I didn't realize that up until recently.
Interesting. Yeah. So here we go again. That depends on what state you live in, right?
Yeah.
What you can do, what benefits you get,
Yeah.
limits you have.
But again, you know, even Medicaid, you know, with allowing each state to sort of, you know, develop it as it sees fit, you know, there are some basics that Medicaid does require, and that's what we're looking for in terms of the issues that we've raised. That there should be some, you know, income and asset, you know, floor limits, you know what I mean, that are realistic and that sort of in sync and aligned with new SSI limits on income and assets. And again, the marriage penalty should be something that, you know, hopefully CMS would say, you know, no state can have a marriage penalty, you know, whatever,
Right.
whatever you get for an individual, it has to be doubled for a couple.
Yeah.
Thank you.
Thank you.
Thank you both. And I'm reflecting in a couple of responses back in comments that these actually came from Serena Lowe. One, providing a link from the SSI federal website, which shows the asset income limit information that is available. That is, again, that's the federal website, and referencing back to what you were talking about, Paul. And Serena also noted that the ABLE account contributions is not a common practice, but you can find information about ABLE accounts and how they're being leveraged and used at the National ABLE Resource Center, which is, the website is www.ablenrc.org. So there is some information being shared in chat. I just want to make sure people have access to that. And I see Kelly, I'm sorry, James, you've got your hand up as well. Yeah.
Yeah, it's related. We're talking right now. I have like they have 3 different sections of ABLE you could put in your money. And with that, it's not going to interfere your income with your SSI or SSDI. It's two separate things. They don't hold that income, but the ABLE account have a cap up amount of money. I can remember top of my head, but the SSDI or SSI don't look at those 3 sections. They just look at the money you have in the accounts you have. It don't look at your ABLE account at all. They look at the money the person have in their individual account. Oh, the cap is $100,000 of all three sections of ABLE accounts, $100,000.
Okay, thank you. Thanks. Now, I want to turn to you, Kelly. You have had your hand up for a good while.
Yeah, just because I'm so old, thought I would add a little context here. So I was on SSI in 1976, 77, 78. Does anybody want to take a guess what the asset limit was? It's $2,000.
2000?
So 50 years ago, almost, the asset limit was the same. That's the context I'm trying to give here. It's like, it's abhorrent that it's still at $2,000. There's no way it should still be there, because that $2,000 in 76 would buy you a car. But the other thing I would just wanted to bring up was the WIPAs. I don't know if somebody has already talked about those, but the Work Incentives Planning and Assistance Program can help people work through, because you can tell by all the websites that are being posted about Medicaid and ABLE accounts and all that stuff. WIPA is a really good resource for people to try to figure all that stuff out. Not very much fun, not very well funded, but it's there.
Thank you. Thank you for the context and also additional information to be shared. Terrific. So Paul and Sean, I really, I'm seeing there's been a full amount of conversation that we've had, and I see that, again, we've got a little bit of the comments slowing down in chat as well. And Paul or Sean, do you have any closing remarks?
Just thank you for this amazing opportunity to give all report, and yep, that's it.
And I'll say thank you also to Sean and all the members of our work group and to the committee as a whole and ACI and again, our chairman, Jim Brett. And I will tell you, I'm excited about getting this report done. I'm also excited to the point that Jim made that the advocacy that'll happen soon thereafter. So we're all set. So thank you.
Get ready, Paul.
Terrific. Well, thank you to you both and to the work group that contributed to this final section, the federal supports program. In this space, I'm just about to transition back to our closing remarks by Chairman Jim Brett. And before I do that, I just want to again express my appreciation to you all committee members for your hard work within this committee and within work groups to produce this robust set of recommendations that has been the focus of today's conversation. I also want to thank the committee members and the members of the public who've been watching us as you were able to bear with us for some of the technical glitches we worked through. And I really appreciate everybody's real focused attention all the way through this afternoon. With that, I'd like to turn it over to Jim.
Great, thank you. As we wrap up today's meeting, I'd like to thank all the work group chairs and members for surfacing the issues and proposing recommendations to be incorporated in the PCPID report to the president. Thank you to the full committee for providing further input during the meeting discussion. Also, a very special thank you to Alex for facilitating today's meeting, and Serena as the PCPID writer and the team census for operational support to us at PCPID. But a very special shout out to David Jones. I think I speak for all of the members. I think he's done an extraordinary job providing information and always being available. I know that many of you have already commented that he's always been there and giving you updates and as much information as he can. So I just want to say thank you to David. He reflects so well on the agency. Today's recording, PowerPoint, and the minutes will be posted on the PCPID website during the week of April 15th. From today's meeting, we'll use this information today to help further refine the current draft of the PCPID report to the president. As we look ahead, our goal is to share the full PCPID report for full committee review that will then be followed with a virtual vote. And we aim to complete this process. We were hoping by the end of April. It may end up being the first week, the first 10 days of May. Therefore, our goal is to issue the PCPID report to the president during the early summer. And again, we're hoping maybe sometime early in June to coordinate with the Olmsted celebration. I believe that our time together today was well spent to take meaningful steps to propose to the president a roadmap on how the nation can strengthen and expand home and community-based services for people with intellectual disabilities. I opened today's meeting with 4 exploratory questions that each of the work groups to help PCPID examine what is possible as we address issues surrounding HCBS. Each of your ideas and the voices that you shared during our meeting today are important seeds being planted to further promote the full participation of people with IDD in their communities. Together, the PCPID committee's collective efforts to nurture these ideas as one collective body will hopefully open a world of opportunities for so many in our nations. Thank you, and I will now adjourn this meeting.